A very good evening to all of you. I, Dr. Pooja from India Spine Injury Center, welcome you all the faculty members, panelists, and participants to this webinar series conducted under the aegis of Journal of Clinical Orthopaedic and Trauma, an official publication of Delhi Orthopedics Association. This webinar series named Scientific Writing of an Original Article, conceptualized by a training committee of JCOT under the thoughtful leadership of Dr. H.S. Chabra, Editor-in-Chief, Journal of JCOT, and Medical Director, Indian Spinal Injury Center. This two-day webinar series was planned to brief you and imbibe all the aspects of scientific writing. Now I would like to invite Dr. H.S. Chabra to initiate the session and welcome our keynote speaker. Over to you, Dr. Chabra.
Thank you, Pooja. Welcome everybody to this Journal of Clinical Orthopedics and Trauma webinar on scientific writing of an original article. Warm welcome on behalf of the entire editorial board to all of you. Warm welcome also on behalf of the Delhi Orthopedics Association. You're aware that this journal is an official publication of the Delhi Orthopedics Association. So, not taking much time further, may I invite Dr. Jeffrey Wang to deliver the keynote address. Just a brief introduction about Jeffrey Wang. He's a professor of orthopedic surgery and co-director of the University of Southern California Spine Center Orthopedic Surgery. His special areas of interest are gene therapy treatment and minimally invasive surgery for spine disorders and bone growth biological proteins. Dr. Jeffrey Wang is renowned globally for his work in the field of spine. He is a prolific author, and he is also the editor-in-chief of the prestigious Global Spine Journal, the Journal of AO Spine. He has numerous leadership roles in nationally respected medical organizations, including serving as president of the North American Spine Society, the Cervical Spine Research Society, and Society for Brain Mapping and Therapeutics. I won't take much of your take much of your time further, because you all would be looking forward to a great talk from Dr. Jeffrey Wang. So over to you, Dr. Jeffrey Wang.
Great. Thank you so much. And thank you for the invitation. I'm going to share my screen. Let's see. And please tell me if you can see it, if you can't see it, or if there's any audio problems at any time during my talk. Please feel free to interrupt me.
We can see it very well, Dr. Jeffrey Wang, and we can hear you very well. Please go ahead. Thank you.
Great. Thank you. So first of all, it's my honor to speak to people. This is something I'm very passionate about, and happy to talk on this topic because I think it's something that hopefully you'll find very informative. When I looked at the topic that I was asked to speak about, I kind of realized it was kind of how to publish a paper, choosing the right journal, how to prepare your article and your research. And I certainly hope you find this informative. So these are my disclosures. I do have royalties, investments. I'm currently on the board of directors of the AO Foundation. None of this will affect what I'm speaking to you about today. I think the most pertinent disclosure is that I do sit on many editorial boards of journals as a reviewer, and I am the editor-in-chief of the Global Spine Journal. But I think my other disclosure or disclaimer is that what I'm about to talk to you about are my own personal viewpoints. There might not be a scientific basis for my comments. It's really just my experience. And I would encourage you, especially in this area, to seek multiple opinions, because what I'm going to talk to you about really has worked for me in sort of publishing articles. I am speaking a little bit from the perspective of the Global Spine Journal. We do see a number of articles. We have thousands of submissions each year. And I also would like to just put a plug in for the Global Spine Congress, where we present our sort of top articles, top reviewers, and top editors and top papers at this meeting. And would love to see you in Prague for this meeting. And so I first like to start with the basics. Obviously, if you've gotten your research project, you've gotten IRB approval, and you're submitting it to a journal, it's important for the authors to understand the process, because you love your research and obviously you're very invested in it. You've taken a lot of time and you've put a lot of your hard work into it. And a lot of times when you submit your journal and say you get rejected or you are asked to revise it, I just want to make sure you understand the process and maybe the attitudes. And well, I guess what I'm trying to say is that no one wants your submission more than the journal, and no one wants your submission more in the global, for example, the Global Spine Journal, than me as the editor-in-chief. I don't care who you are. It's a blinded process. There's no bias involved. We want the best papers into the journal. And so what you have to understand is that although you may not succeed at first, it's important to, we call this expression in the United States, check your ego at the door, meaning I know that you enjoy your research, you think highly of your research, and when you get negative feedback, perhaps you might take it personally, but please understand the process is that no one wants your paper more than the editors of the journal. And then when you choose the right journal, you have to look at the journal's focus, right? For example, I'm a spine surgeon, and so I tend to lean towards spine publications. As an orthopedic surgeon, there are also the opportunities to send it to more orthopedic journals, but also I kind of look at who I want to read it. Do I want spine surgeons to read it? Is it more appropriate for a spine surgeon? Is it more appropriate for a basic science journal? Or is it more appropriate for a general orthopedic or even a neurosurgery journal? And so it's important to understand the different focuses of the journals. The other thing is, and a lot of people I think don't think about this, think about the readership, because a lot of times you may sit there and say, well, I would like to get my my research and have a lot of people read it. Other people would say, well, I want just like the highest prestige. I want the highest impact factor. I can recall when I was a resident in training, I published 2 papers at the same time. One went into the Journal of Bone and Joint Surgery, which had a very high impact factor. And the other one went into what we call a throwaway journal, a journal that no longer exists, but everyone got it for free. And one was just the silly paper. It had very little academic value as a case report. But what I realized is that when I published those 2 papers at the same time, the case report, which was very low scientific quality, more people mentioned it to me than the higher quality paper, because more people read that very small throwaway journal and very fewer people read the other journal. And so I guess a lot of us tend to pick the journal based on impact factor, and I think that makes a difference, especially if you're in academics. But just understand, for example, Nature has a very high impact factor, much higher than the Global Spine Journal. How many of you people read Nature? How many of your colleagues read Nature? I can tell you, I don't read Nature on a regular basis. I read spine journals. And so oftentimes, obviously, if you're going for your academic advancement and you publish a paper in Nature, it's much more prestigious, but not a lot of colleagues read it. Not a lot of spine surgeons read Nature, but a lot of spine surgeons will read the Global Spine Journal or Spine or one of the other journals. And so please understand a lot of it, think about your audience. And obviously you can't go with just impact factor. You have to think about the journal, and then also think about the quality of your submission, because the journals are kind of on a hierarchy. And obviously you would want the most high quality journal in your field, with usually having the highest impact factor, which is typically how we pick our submissions. The one thing I can tell you is that when you're preparing the manuscript, follow the regulations, follow the rules for submission. Not every journal has the same process. Every journal is formatted slightly differently. There's a lot of similarities, but they're all completely different. And so one of the problems is that say you format it for one journal and perhaps it's not accepted, and then you submit it to another journal. If you don't change the formatting, a lot of times we know which journal you send it to. If it's organized with a certain abstract that's structured that doesn't fit with the formatting of, for example, the Global Spine Journal, then I can tell, or the reviewers can tell, that it was actually submitted to a different journal, and oftentimes we know exactly which one. So just make sure you follow the instructions for each of the journals, because I think it shows that you're paying attention. The other thing, which I don't think is that big of a deal, in India and places like that where you speak English and it's very your English skills, I can tell you that if you're, I always give this advice to people from China, from people from where English isn't the first language, is that try to get some English language editing, maybe from someone, a professional, because this is your time to put your best foot forward. And if you have poor English skills, you may have the greatest research project and your results may be amazing, but if it's difficult to read, it's hard to follow. It's sometimes, it might be judged more poorly. And as a reviewer and editor, it's much more work for us, because not only do we just judge it on the scholarly and the quality, but then we have to also do some English language editing. And a lot of times it's just not possible to save an article. From a reviewer standpoint, you have to understand that there are volunteers. And so they give their time on a voluntary basis. So do we as editor-in-chiefs, and we're busy. Everyone is busy. You're busy, we're busy. And you have a little time to make a first impression. So you want to put your best foot forward. Make sure that the paper is organized appropriately, has appropriate grammar and flow, at least run spell check. If you have misspelled words throughout the manuscript, and you'd be surprised, that just shows lack of detail, and it may come across as a poor quality. Figures pointing the wrong way, not formatted appropriately. Those are things that can make a bad first impression. And then in the abstract, I always say, don't overstate your conclusions. You think your research is fantastic, but don't overstate it. I always say use these less definitive statements. When you say you're putting forth a paper, you sit there and say, well, this might be an option. Our results show this is possibly a better option. What you don't want to do is sit there and say, this is the best thing, this is the only way to do it. You just want to make sure that you use the appropriate language. But this is your time to make a first impression. And don't make the reviewer search for information. Because if you don't put things in the abstract, for example, follow-up or the number of patients, right? Then I can't sit there, and a lot of times I don't get that information till later, and it just comes across poorly. It almost comes across as you're trying to hide the data. When you're doing the introduction part, start broad, but get to the point. You know, a lot of times I see paragraphs and paragraphs of just too much background. This is your chance to tell the reader and the reviewer the quality of why your article is significant. You may sit there and say, this is the first paper to look at this topic. This is the first paper to compare this, right? You sit there and say, there's older research on this, but this is the first paper to do this, this, and this. This is your chance to tell the authors, the reviewers, the editors, why your research is significant. And I think it's important for you to put that forward. And then I always say, end the introduction session with a clear objective of the study, because sometimes you'd be surprised, you're reading the paper and you don't understand what the focus is. Keep it anonymous. For the methods, be clear and concise, use the appropriate statistics. And I always say, suspense can be negative. If I have to read and I'm already through the abstract, introduction, methods, and I'm in the results, and that's the first time I see that you only have 5 patients versus 500 patients, or your follow-up is only 1 week rather than 2-year follow-up, that can be negative because it looks like you're trying to hide it. And so I always call it suspense can be negative. Make sure you put the data out there and let it be judged. In the discussion, I always say review the literature, but this is, again, your time to show why your study is important. Put your results in context. I always sit there and say, maybe you're published, for example, an article on total disc arthroplasty in the cervical spine. Well, there's been a lot of articles published on that, right? And so what you want to understand is why your article is special. You may sit there and say, previous studies have shown this. This is the first study to show this. This is the first study in this population. This is the first study. Again, this is your chance to show why your study is important. And then if you do have weaknesses, go ahead and put those out there. I find it so much better if the authors themselves include in the discussion, these are the weaknesses of the study. It's a retrospective study. We didn't have as many patients. However, you try to also state why that criticism isn't valid, or why your article is still very important. And I, again, say be humble. Use terms like, this may help us choose as practitioners. This might be a possible alternative, but I wouldn't be overreaching with your conclusions. I always say, write a nice letter, be humble, follow the instructions of the journal, look at the website. And then if you get feedback, be nice and be honest with your expectations. If you get a chance to revise it, this is where a lot of submissions fail, because a lot of times authors are offended. They think very highly of their own research. They are not accepted right away. They're reading the reviewers and they're being critical of your paper. And a lot of people take that personally. But I sit there and say, please understand, when you're submitting your original article the first time, your goal is to put forth the best scientific paper you can. If you're given the chance to revise it, your objectives change completely. Your objective is no longer to put forth the best article. If you're revising it, your goal is to appease the reviewers, because the only thing standing in your way of getting it accepted is to answer those criticisms, justify why those criticisms aren't valid. And if you put forth your goal as just addressing the reviewers, then they cannot reject the manuscript, because they've already put forth why they would not accept it. They put forth the criticisms, and so you have to address those criticisms. And I always say, be humble, be polite. If you imply that you're offended, or if you resist the comments, the criticisms, and you don't make those changes, then they're going to look at it as you're not being humble. You're not taking them very seriously. And I can tell you, if you're doing a review and you sit there and you put forth and you take the time to put forth why the revisions need to be made, and the authors don't do it or they ignore it, then the original criticisms are valid. They haven't been addressed, and there's no reason to accept it. Make the deadline. You're usually giving a deadline, and oftentimes people don't make it. It's laborious. It's not pleasant, because when you're revising it, because you're addressing criticisms, and oftentimes you delegate it to the junior person. This is where the senior author, I feel, needs to step up and make sure you've addressed everything. I always say, address each point, address each criticism, explain why it's not a valid criticism, or you might sit there and say it is a valid criticism, and explain why you would kind of think it's not that big of a deal. And I would sit there and say, be positive about it. Other times, a lot of times reviewers will make positive comments. They'll sit there and say, this is very well organized. This is a great paper, and these are the things I'd be concerned about. Make sure you put that in your revision. Sit there and say, thank you. Thank you for those positive comments. These are the things we addressed. But if you address all of those, they cannot reject you. And if you address each concern, show why you made the change, great. If you feel the comment is stupid and you think it's ridiculous, still use the appropriate language. I always sit there and say, right, thank you. Thank you for your suggestion, but you may not make the change. You may sit there and say, thank you, it's a good point, but we feel that we don't really need to change this because this, and this. And if you're very polite about it, a lot of times reviewers sit there and say, well, I'll accept it anyway. If you make the change, take credit for it. Thank the reviewer, point out the change, and show that you're cooperative. If you don't make the change, politely state why, because you don't have to make every change. You can sit there and say, well, we didn't feel this needed to be changed. You don't have to make the change. And then don't get upset. If you get a rejection, you already have these reviews to help you make the manuscript better. And it may give you some ideas to make some positive changes, and then you can submit it to another journal. And if you have just impolite behavior, there's no chance you're going to get accepted. If you write a letter and you're resistant to everything and you don't show that you're willing to try and make it better, then you're probably not going to get it accepted. And also, please understand, you may not understand the immediate goals of the journal and understand the process. I'll give you an example. In the Global Spine Journal, sometimes you can submit an article and a reviewer in three different reviewers, different locations of the world will review it, and they can be positive comments. The reviewer is only reviewing that article. And then you get it back and you sit there and say, all three reviewers say this is a great paper and should be published. And then it gets to the editor-in-chief and we reject it. And then I can tell you, this is the most common inquiry we get. The authors, and it's valid, the authors sit there and say, well, the reviewers are very positive. Why wasn't it accepted? What you don't understand, just to give you the understanding the process, is that the reviewers don't understand the global picture of the journal, meaning they don't understand, they're just reviewing that article. So there are some articles we get, three reviewers very positive, and say, for example, it's on cervical disc arthroplasty. But when it gets to the editor-in-chief, we may sit there and say, that's great. Your article was very positively reviewed, but I have 6 other articles that have more patients, more follow-up, better quality, and we're publishing those. And so we don't need another one, right? And so what you have to understand is that can still happen. And I understand that creates a lot of distress, because a lot of the authors feel like, well, it's been positively reviewed. Why aren't the editors-in-chief accepting it? When the COVID crisis came and we had the pandemic, I got so many articles on COVID. It was amazing. And at first we took the highest quality ones, but then we just had so many, we just couldn't publish the whole journal on COVID. And so just understand that the editors-in-chief have a global picture of the journal. And then reformat it, use the criticisms to go into the future and gain insight into what the reviewers are viewing your paper, make the corrections, address the concerns, and submit it to another journal. These are some tips. I'll just finish with some tips. If you have a body of research, you've already published 20 articles on this one topic, sometimes you can discuss it. You can sit there and say, in my past results, we published a lot of this, but this is the significance of this study. But it also tells the reviewers, hey, these guys have a track record. And also, I always say, stay polite. It's very important to stay polite. And so I think I'm running out of time, but again, these were some of my random thoughts that have worked for me in publishing articles. It may not work for you. You may have developed your own style, and some of the thoughts you may differ. Some of the people you work with may have different thoughts. And my suggestion is to just take some of these informations, try to synthesize it, and then see what works for you. I can tell you that we need this research as a journal editor. We need those submissions. So I invite you to submit, but hopefully you'll have a bit of an understanding of the process. And with that, I thank you very much for your attention, and thank you for inviting me. I really appreciate it.
Well, thank you, Dr. Jeffrey Wang. That was a great talk with some very important tips for all of us, and also the young colleagues who are interested in publishing. We will have questions from everyone. Just wanted to start the discussion. What is the most common cause in your experience for desk rejection of any manuscript, even before it goes for review?
Yeah, that's a great question, because we have 4 of our deputy editors basically do the desk rejection. And I can say that we have criteria. I can just speak for the Global Spine Journal. We have certain criteria. I don't have those criteria in front of me, but we don't take case reports. You can maybe put a case series, and maybe a lot of times the case reports is one single case report and they do a review of the literature. It's much better to have that review be a review. Review papers are very highly cited and they're very highly sought after. So I would say that don't do it as a case report. So that's one of the criteria. We have a certain reasonable amount of follow-up with some special exceptions. We need a certain amount of follow-up. We need it to be somewhat formatted, or we'll send it for like English language editing. But we have a whole set of criteria. But the bottom line is a lot of it's about the quality, the number of patients, the follow-up. The topic might be off kilter. We're a spine journal, so Global Spine Journal is a spine journal. If you send an article on hip arthroplasty, that's a pretty extreme example, but obviously that would be just rejected right away.
Right. Thanks, Dr. Jeffrey Wang. Also, then, what in your experience are the most common causes of rejection at the stage of the reviewer? So even before they send it back for a revision, what are the most common causes for rejection at this stage?
Yeah, so I would say I would say that some, we send most of our papers back for review, and I see one of the most common things is some people, they just don't get around to it, and I looked at that as a missed opportunity, because we give them a deadline, we say submit the review by this time, and I'll get so many submissions from colleagues that saying, hey, we missed the deadline, can we have more time? And I'm usually very open to that. But for me, it's like, well, boy, this is your great opportunity. Why not just follow the instructions? Why not address every point? I will say that the reviewers are volunteering their time. And so we don't pay our reviewers. I don't think most journals pay their reviewers. So they've taken the time to put forth these criticisms, and they're just suggestions. I would look at it as some suggestions. And I would say that one of the reasons why they would reject it afterwards with the first revision is because they don't address all the concerns. Sometimes they ignore the concern. Sometimes they talk about it and they just send back like, we don't need to make this. This is just, or they'll actually use language that kind of implies, well, this is a really stupid comment. And obviously that offends the reviewers. And I think that's reverse of the objective. Because what you want to do is be very, very polite to the reviewers so that they'll accept it. Because that's the only thing standing in your way for them getting an acceptance.
Thanks. While we invite any of my colleagues who are there on Zoom to put their questions across by raising their hands, so we'll simultaneously get any questions from the portal in the chat box here as Ravinder gets them here. So I'll put another question to you, Dr. Jeffrey Wang. Would you say overall one of the most common, I say, if our young colleagues need to give importance to any point for publication, so it should be to try to initially find out an important research question which would be of interest and which there's a good chance of publication because there has not been much work on it. So would you say that is an important consideration for our young colleagues to focus on so that they have a good chance of their manuscript getting published even before they start the research? Yeah.
Absolutely. That's such a huge important point, is picking the right topic, picking the right the research. For example, if you're trying to do a research project on the use of pedicle screws for lumbar fusion, that's been published for years. That's not that much of an interesting topic. You might find a spin, something unique about that. But also choose, I always say, choose the right topic. The best projects for me are when the students or young surgeons are doing a research project, and I know that whether they find positive or negative results, it's still going to be interesting. Because if you pick a topic that's very, very controversial or very important, you might find different results. But regardless, people want to know the answer to that question. There are other projects where you sit there and say, well, if we don't find anything significant, it probably is not going to be worthwhile. And then you might have wasted some of your time and less likely to have a high quality manuscript.
Yeah, Dr. Vineet Arora has a question for you, Dr. Jeffrey Wang. Dr. Vineet, please go ahead.
Yeah, thank you, Chhabra sir. Thanks for nice presentation, Dr. Wang. I think the message was very quite crystal clear. For the speaker and the audience, I just want to know one important thing. As you said, that the article or manuscript can be rejected at many places, maybe at the level of reviewer or deputy editor, or maybe at the editor level. So of course, is the editor-in-chief is the overall in charge, and he is going to take the responsibility of publication of the particular manuscript as well. So if the article is being rejected at the level of EIC, so do we have any chance of getting it reverted? What's your opinion about that?
Yeah, so So the answer is yes. There's always a chance. I can tell you, we get letters all the time where it's been rejected at some point, and they ask some questions, and we may re-review it. I think it has a higher chance of maybe being reconsidered if it's rejected at maybe a lower level. A lot of times it'll be at desk rejected, and like, for example, one of the things we found out is that when we desk reject it, they may desk reject it right away, but we wait a week before we let the author know, because some of them will come up to me and say, I submitted it Friday and it was rejected the next day. And so that looks bad, and I understand that. But that's just the day where the deputy editor desk rejected it. A lot of times I'll get it's very common to get an inquiry saying, look, our article had very positive reviews and it was rejected later by a deputy editor. And so we may sit there and say, well, we review it. And so we assign it to a different deputy editor, and then it has a different chance. If it's at the level of the editor-in-chief, it's probably unlikely, but we're always happy to reconsider. And so I can tell you this, one of the policies we have in our journal is that if someone sends us a letter, we take it seriously. And so we will always look at it, and we go back to the person who rejected it and say, would you consider reconsidering this? If it's at the level of the editor-in-chief, then obviously it's a little hard to reconsider, but we always will take another look at it.
Oh, thank you very much.
Sure.
Yeah, Dr. Jeffrey Wang, I would want to also put another question to you, more to gain from your vast experience in this field and also your experience in the Global Spine Journal. Is the type of the manuscript, whether it's prospective trial, retrospective trial, or review article, or a case report, is there any value that, or do they differ in the value that they contribute to the literature? I'm asking it particularly because there has been some discussion also on the importance of case reports. It may not be necessarily that a certain type of article adds more value. Sometimes even case reports could add a great value to the literature. So what is your experience, and any particular reason why the Global Spine Journal does not accept case reports?
Yeah, I could tell you that it was a bit controversial within our board of the journal when we decided to eliminate case reports. What we found is that we were getting submissions that were such higher quality than a case report. And partially it was a journal decision because case reports are not that highly cited. And so it just takes away from the impact factor. And when you govern a journal, you have to think very globally. You have to think about all different aspects. And so that's one of the reasons why a lot of articles or journals shy away from that. There are also, though, a lot of publishers that have created journals that do case reports. And so there is a venue for case reports. And that is where I think you should maybe look at the right journal. Because oftentimes when we reject case reports, we give them another solution. There's another journal within the SAGE, which is our publisher, that does publish case reports. But I think the main reason is that when a journal gets to a certain level of maturity, you start to worry about the impact factor. And we could argue about the impact factor all day. Even the people in publishing feel like the impact factor is really not valid anymore, and they're going towards other measures. But right now, a lot of people put a lot of weight into the impact factor, and it unfortunately detracts from the impact factor.
Thank you, Dr. Jeffrey Wang. We have Dr. Bijlani Singh who wants to ask you a question. But other than the case reports, any particular type of manuscript that your journal is particularly interested in, or it would depend on the quality of the manuscript overall?
I think it depends on the quality, the topic. There's so many things that go into it. For example, robotics and navigation. Robotics is something really new. And we published a special issue on robotics. I can tell you that when you look at the scientific validity of it, because we don't have a lot of data on it, scientifically, those articles were not as strong as some of the other topics. But because of the topic was so new, we don't have as much data. Those were very highly read, highly cited, and very interesting. And they were downloaded by so many people. And so that's a situation where the topic was so new and so interesting that it overcame a little bit of the scientific limitations.
Thank you. Dr. Bijlani Singh.
So you are mute.
Yeah.
Thank you. So just realized. Thank you, Dr. Chabra, and thank you, Dr. Wang. I thought Vivek's hand was up there as well. Did he get his question done?
Yes, sir, you please go ahead with your question.
Okay, sorry. So just going along the lines of the same question that was asked earlier, that if a EIC has rejected a paper, so, but slightly different, what I have noticed is that I'm the deputy editor on this journal, and when I assign an editor to send out for reviewers, what I've noticed once or twice is that the editor has himself or herself made the decision to accept that paper. Now, when I read the manuscript, I may not agree entirely. Yes, that it's a reasonable paper, but it doesn't add anything new. So then to go and reject that paper becomes a bit more difficult for me. So how do you sort of deal with that kind of scenario? Thank you.
Yeah. No, I think what you're getting at is the different levels and the different responsibilities of reviewers, deputy editors, editors-in-chief, and I think the higher up you go, the hierarchy, the different focus that you have. As I mentioned earlier, the reviewers, they don't have a global view of what else is being submitted. They're just judging that one paper. So a reviewer is actually the most the honest, I guess, about it, because they're just looking at that one paper and they may give positive reviews. But then it goes to the deputy editor and they may sit there and say, well, you know, I've reviewed in the last week, I've reviewed like 25 articles on the same topic. And the other 24 were much better than this one. So from a more global standpoint, this one is, we really don't need this. And then when you get up to the editors-in-chief, like, for example, I see all the different articles, and the pandemic is a great example. We had so many articles on COVID. We actually at the higher level just sit there and said, if I see, we're not going to accept any more surveys on the pandemic, and they're just repetitive. And they again, great reviews, very timely because we were in the pandemic, but we had so many COVID articles that were redundant. At the higher level, we sat there and said, this is a great paper, but we're not going to publish it. That's just one example, I think, of people have a different scope and different duties within the journal. And I think every journal is probably a little bit different, but I can tell you with our journal, everyone has a bit of a different, they're looking at different things. For me, I'm looking at the scope, the landscape of everything that's been submitted. I don't know if that makes sense.
Yeah, makes sense,
Yes,
Dr. Jeffrey Wang.
Thank you.
We have the last question by Dr. Vivek Trikha, but just adding on to what you said, I think if the editor-in-chief tends to differ from a decision that a deputy editor has made, it always makes good sense if the editor-in-chief can get back to the deputy editor and say why he differs and then come to a consensus in this regard. So that encourages teamwork and takes things forward. So that is one thing that we all take care of. Dr. Vivek Trikha, the last question.
Yes. Thank you, sir. And my question is regarding the reviewers' queries which come and the revisions which you need to make. And Dr. Wang was elucidating to it regarding, my question is regarding the same thing, regarding how you are able to maintain, and how as an author, how much should I be answering or agreeing to the reviewer's point while maintaining my originality? Because as a reviewer also, I conform to some standard ways of thinking. And this is an originality or original article which is coming, and I want it to be molded into the standard norms. And while I know that this is an high impact, or I want to get it into this journal, how do I modulate that while maintaining the originality and also conforming to the queries which are the reviewers' thing? Because that becomes very tricky for the authors out here, and that will be a question for all the people who are listening out here right now.
Yeah, that's a great question. And that's where I think a lot of submissions fail. And so, as I mentioned, and again, this is just my opinion. In my opinion, you don't have to make every change. You do have to address every point, though. And I can tell you, when we're revising an article that we've submitted to another journal, and we get that same query or the same criticism from the reviewer, we address every single point. And if you read the letter we send with it, it's very polite. It basically says, thank the reviewer. I always say the manuscript is much better after their suggestions. Here's a point-by-point view. And there are some reviewers that just miss the whole point of the paper. And a lot of times they didn't read it carefully. And a lot of times their criticisms are just wrong. They'll sit there and say, well, this was this. And an example, you're like, well, they just didn't read it. We'll point that out in a nice way. And so I address every concern, but you don't have to make every change. There's been articles that we've been revising where we've made no changes, but we've addressed every point and we explain why we didn't make the change. We say it very politely. We sat there and said, well, it's impossible to increase the number. This criticism of increasing the numbers, we sit there and say, ideally, we would have much more patients, but it's impossible to go back and do that. But we agree that this is a weakness, but at the same time, we feel that this is such a novel topic, it still provides good information. And so I kind of turn it around on them in a nice way and sit there and say, thank you for your comment, but we're not going to make that change, but I explain why.
Thank you, Dr. Jeffrey Wang. There has been a lot of interest generated by your wonderful talk, and we could go on and on, but we have to proceed also with the other parts of the webinar. I would only want to request you to also be available subsequently for another such webinar so that we could learn more from your vast experience in this field. And I would want to inform you that we at the journal have virtual special issues, and if possible, we would want to explore a virtual special issue on spine in collaboration with the Global Spine Journal, if that would be possible. We have a virtual special issue on spine being released shortly, but we'll look forward to various ways of collaborating with your journal if possible. So thank you very much, and we appreciate your having taken off time, especially early Sunday morning. Friends, it's 6 o'clock still where Dr. Jeffrey Wang is, 6 in the morning. So thank you very much, Dr. Jeffrey Wang. Look forward to continued collaboration between the journals. Thank you.
Absolutely. Thank you so much for having me. I look forward to collaborating with you again. Take care.
Thank you.
All right. Bye.
Over to you, Pooja.
Thank you, Dr. Chabra, and thank you to Dr. Jeffrey. And hats off to his commitment. Early morning, he got up and delivered his lecture. It was very, indeed, a enriching experience, especially big takeaway from his session is that it's very important to focus on the viewership or readership of the article rather than focusing on the impact factor, right? So with this, we go on with on our next session. Before that, I would like to make one announcement. All the participants who have joined from the OrthoTV link, please put on your questions through their link. We'll take up your questions as per the sessions. Now, going ahead with our next session, I would like to welcome Dr. Vivek Tarika. Dr. Vivek is a professor at AIIMS, New Delhi. He has a medical training and more than 25 years of experience at AIIMS, New Delhi. He is a regional and national faculty at AO, SCIOT, APO course on orthopedic and trauma. He has given more than 500 talks in various conferences and courses. He has more than 150 publications, and he is academic in charge of IOA. He was the vice president of Delhi Orthopedics Association. Over to you, Dr. Vivek.
Thank you. Let me share the slides now. And thank you, everybody. Thank you, JCOT and Dr. Chabra for giving me this opportunity along with Delhi Orthopedic Association. And my panel discussion is going to be regarding the basic things of author guidelines, the manuscript central or the peer review management system, and how to choose your authorships, how to decide how to give authorships. And to discuss these various points which come into the mind of the people who are writing the original article, I have got a very expert panel, starting from Dr. Srinivas Kambampati, who is in Vijayawada, who is an arthroscopy and arthroplasty specialist at Vijayawada. He's an editor-in-chief of Journal of Arthroscopy and Joint Surgery. He's an associate editor in IGO and JCOT, and also Indian Arthroscopic Society Journal. He has authored more than 50 articles, chapters. He's faculty in IGO and JCOT organized scientific writing meetings. He has also himself organized scientific writing meetings by IGO and OSAPCon in 20 and 21, and is also a previous member of Shoulder Elbow Committee in JCOT. I would welcome Dr. Srinivas Kambampati, and I feel that your ideas will enrich the audience out here a lot. Besides him, we have a next panelist who is Professor Harish Kumar. Just 1 minute. Yeah. Harish Pemde, sir, who is a director professor of pediatrics at Lady Hardinge Medical College. Please mute yourself. Thank you. And he's a director professor of pediatrics at Kalavati Saran Children's Hospital and Lady Hardinge Medical College. He's chairman of Adolescent Health Academy, Indian Academy of Pediatrics. He is also Adolescent Health Indian Association Vice President of the Southeast Asian region. Has got a lot of experience in training and research in adolescent health in a WHO collaborating center, and is involved as a member of the technical advisory group in adolescent health in the Ministry of Health and Family Welfare. I think that his ideas and his guidance in these writing papers is going to be of enormous help to everyone. Then we have one of the brightest peoples at All India Institute of Medical Sciences, my colleague, Professor Bhavak Garg, who is special interest is in spine surgery. He's a board member and reviewer of various national and international prestigious journals. He is former member of International Education Committee of NAS, member of various scientific committees of more than 30 societies, authored a wholesome 255 international and national paper publications, authored 2 international books on spine, 35 chapters, and is a well-known figure internationally in spine surgeries and in basic research in spine. So I would like to welcome all my 3 panelists, and I feel that we would be able to do justice to the session which has been given to us regarding discerning author guidelines, manuscript central, and authorships. So without much further ado, I would like to start the questions by saying to Dr. Harish, sir, when we ask an author that he has to submit it to a journal, what do you feel comes into the minds, and how relevant are the submission guidelines of a specific journal to that author?
Thank you, Dr. Trikha, for inviting me to this very important program. And we have heard Dr. Jeffrey Wang giving an bird's eye view of publication of a paper. I think the message was very clear from him that when we are submitting, we must know what editor wants. So we have to read, we have to know the editor's mind, then only our paper gets published in a particular journal. So how you get the editor's mind? It is through submission guidelines. Okay, so whenever we do a research and prepare a basic manuscript, that is the step 1, then we have to read the submission guidelines very, very carefully, because these guidelines only will tell you how to draft a paper according to the needs of a journal. Dr. Jeffrey Wang was saying that he can know that where this paper was submitted earlier. So these guidelines are so unique to every journal that whenever you are submitting to some journal, you must read about it, the format of your paper, the writing style, the word limits of abstracts and other things, keywords, and various other components of the paper are very, very important thing, which we can only know from the submission guidelines. And moreover, submission guidelines also clearly defines at what kind of papers that particular journal will publish. This is also very, very important to know, because we know our paper. We should also know what is the focus area of the journal. So this is very well given in most submission guidelines. So this is primary thing which all the authors should know about it, about submission guidelines. And some journals have a very different kind of referencing system. So this becomes very irritating to the editors if the references are not as per the guidelines of the particular journal. So there are such things, many things which are prospective author should know. And
Right.
beyond that, submission guideline also have how to submit, when to submit, what are the things which a particular journal wants, like copyright papers, etc., etc. These
Yeah.
are also given in submission guideline. This should be known very well to author. Then only we can have higher success rate of publication of our article.
Right. Thank you, Dr. Harish. And what essential is that you should know where you need to go. If you need to put it in a specific journal, you need to know how to enter into that journal. And that's what submission guidelines are for you. They give you the guidelines, they give you a place, a roadmap, how to enter into that journal and get your work published. Dr. Srinivas, can I ask you regarding your experience, regarding which are the 3 points whenever you have a manuscript ready with you as an original research? What are the 3 points which you look for at the submission guidelines and which are very important to you for your submissions?
Thank you, Dr. Trika, for your kind words of introduction. And I would like to thank JCOT for giving this opportunity. To me, I think Dr. Wang has mentioned it and Dr. Pemde has also mentioned it. The most important point to check is the scope of the journal. Which it is one of the most common causes of desktop rejection. And also, nowadays we see a lot of journals coming up with processing charges. I would also look at look if there are any processing charges for publication, so that you would be prepared for paying if you are. Otherwise, if you're not prepared for it and you later find out, then you'll be wasting some time on it. And check for the policies, legal aspects like policies on copyright, conflict of interest. Also, maximum number of authors is important. One important thing I wanted to convey is, because we see some manuscripts, it's the formatting of the manuscript itself, like line numbering and spacing, page numbering. These are important because when the reviewers review, they have to identify areas of the manuscript that have issues. So without these, it's difficult for them to convey. So if you don't have these area identifying numberings, it becomes difficult for the reviewers to communicate with the editor as well as with the authors.
Right. Thank you. You have very importantly highlighted the APCs, because many a times they become, and you don't look at it, and then you are at the end of the road, you suddenly find that you have to pay those charges. Yeah. Now I go on to Professor Bhavuk. Bhavuk, you have published in hundreds and hundreds, so many articles in all the places. What are the things in your armamentarium as a checklist, which when you finally submit, you are going to look for to this specific journal, let's say a global spine journal or some other journal which you are submitting? What's the checklist in your mind which comes that you're going to be publishing and you will keep in mind for you? You are muted. You're muted, Bhavuk. Just unmute yourself.
So actually, thank you, sir. So actually, there is a big myth, that once you have written the manuscript, then you actually start looking for the journal, and then you look at guidelines. Actually, the manuscript starts with the looking at the journal's guidelines. You first have to identify your journal, and then you have to start preparing your manuscript. So this is very, very important. And many of the authors, they actually err on this area. So first of all, like global spine journal. So if I'm planning to put a manuscript in a global spine journal, then I'm going to look at the aims and scopes, as Dr. Harish has pointed out. You look at the requirements of the journal, and we go through in details the instruction of the journals. We go through the open access options. This thing have sometimes like I have got funding from ICMR, I've got funding from DBT, DST. So sometimes these agencies, they also offer the publication charges. They also offer the facility for open access. So actually publishing in an open access is relatively easier in my experience. So you should be exploring that option also. And the other thing is the journals, they use different submission systems, so you should also be aware of them, because sometimes you keep on searching your username, ID and password. for different this thing also. So this is also very important, and then you keep on forgetting password and all those things. So this thing also creates problem. Then you have to go through the carefully consideration of the keywords. What are the keywords which are specific for the journal? Your title. The title should be, very effective, and I prefer to put it in a Pico format. My most of the articles are in the Pico format, because if they're in a question format, they arouse sort of curiosity, and that's how the editors also look at this author as the concept of Pico. Then the cover letter should be very effective. The cover letter should have the details of all the co-authors, and they should also have all the affiliations and all the details. Another thing is, like, you should be aware of the general style guidelines, especially the referencing styles, because my first paper, when I submitted to COR, then I came to know that the COR referencing style is different from the other this thing. So this is very important. You should make your articles easy to read. You may be expert on that particular topic, but the target audience may not be that expert. So you should not be taken for granted as such. Then your methodology should be very clear. That is the most important part of the manuscript. And also, we have got several drafts of the manuscripts ready. So sometimes you should be very careful that whatever the final files are, they should be ready with you. Like people, they submit sometimes the wrong files for the submission, and that is the one of the very common cause of the rejection. The other thing is, like, accidental plagiarism. One should be very careful about the plagiarism. Sometimes your people, your students, they write it, so you should be very careful about the plagiarism also. So these things I always.
Thanks, Babu, for giving an overall picture regarding what all to look for when you are submitting an article to a specific journal. Yeah, I would certainly say, as per the things which Dr. Harish, Srinivas, and Dr. Bhavuk have said, like International Orthopedics, if I can say for orthopedics, they have a referencing which is totally different from others. And as Dr. Jeffrey Wang told, as a reviewer, when it comes to me and I see that the referencing is different, I already know that this paper has been rejected from there, and then it has come to some other reviewer. And that slightly, come what may, it slightly biases the person slightly. He starts looking for things. So though it may not be there or should not be there, but you should make sure that this is the first place and this first journal where you are submitting it. You are conforming to the guidelines which have been given. And that's what we require in research as well, that we conform to the guidelines, to the ethics, and submission guidelines are one of those guidelines that we also need to conform to, besides the article or the study which we have done. That's why choose your journal properly before you think about writing it, or if you have already have a basic template, give the final finishing according to a specific journal. So that brings us to the next topic. As we said, that we have to understand the scope of journal, impact factors, the peer reviews, trends of that, how the referencing is done. I would give you one example of my own publication where I didn't word limits. Regarding the word limits, the reviewers didn't check for it, the editorial staff didn't check for it. And when it went for final publication, then they asked me that your article is going on exceeding around 500 words or so. It is getting on to the third page, and you need to pay the charges for the third page because you are supposedly having your article to be finishing in that. And that came as out of everything had finished and it was accepted, but at the time of publication, because it was exceeding the word. So look for these things to avoid last moment surprises for your publication. Next, we move on to the peer review management system, or the Manuscript Central, which many of the authors may not be knowing about it and how it can be helpful to them. So if I can start with Dr. Srinivas, and then maybe slightly Bhavuk, you can add on to it, that how the authors can benefit from peer review management system, or is it purely for the editorial staff that they can have a management flow by PRMS?
I think editorial managers, or the system is actually very good. It enhances the submission workflows for the authors, reduces the timing, saves a lot of time for the authors to send the manuscript to the editors and to the reviewers. It standardizes everything. The user interface is standard. If you see a lot of journals nowadays, most of the journals have the editorial manager, which is similar So as an author, it's easy for you to submit to a lot of journals, especially if they belong to a certain publisher. And features that support enhanced communications like discussions and communication with the editor-in-chief. These are very useful to communicate during the processing of the journal, processing of your article actually. And research integrity features like duplicate submissions, check. These are also useful both for authors and the editors. And plagiarism check, that is integrated within the editorial managers. Some of the authors do not have access to plagiarism checks, and they find out that there is an increased similarity within their papers from the managers.
Right. Yeah, Dr. Bhavak, would you like to add on to something regarding how the authors can benefit from this?
Sir, you're talking about that particular management system?
Yeah,
or
yeah.
you're talking about
Overall regarding
the peer review itself is a great help, because it is going to enhance your the quality of your manuscript. You get the authors, they get the constructive criticism, so they improve their manuscript. The other thing is, like, the reviewers, sometimes they add certain points which can be a part of your next project, which also guides you towards your next the study and all those things. It also maintains the ethical standards, because if the peer review management system has got the uploading of requires the uploading of the ethical certificate and all those things, so they also help in maintaining the ethical standards. So these are basically, and they also can check your references and all those things, so this is again quite helpful.
Yeah, so authors, it's not only that the peer review management system or the manuscript central is going to help the author, the editorial staff, as well as the editorial people regarding the manuscript, but it also helps the authors, increasing the transparency, and also they know a workflow of how exactly your article is moving around in that journal for that matter. And moving on to the benefits to the editorial board or to the reviewers, Professor Harish, would you like to throw some light onto the benefits of Manuscript Central for the editorial board?
I think having a system of submission and review is also a very, very important point, because various indexing authorities also see this, how a journal is reviewing an article, what kind of peer reviews are being done, and what is the qualification of peers, because peer review also, they get accumulated in some website or on some platform. So this is also very, very important for indexing purpose also. And this definitely improves journals' credibility in the society or medical society. And peer review is also very, very important from editor's point of view, because editors or editorial team, they cannot be expert in everything on the subject. So there may be some few of the subject experts which can review a particular work, and they also give the insight to the editorial board in making a decision about a particular manuscript. And so editorial board also get benefited by that. And of course, the system is very, very important. And making a system is important because editor-in-chief or editorial board may not have that much time to do all those clerical work, I would say, that contacting an author, getting the review and sending it to the editor. So a system has to be in place. And some good houses, editorial houses, have a very good peer review management systems, which is very important. And for initial or new journals, this is very difficult to get all those things. But having a good management system is very important for editor's point of view also.
Thank you. Thank you, Professor Harish. What I would like to summarize for the peer review is that it's a modality which is helpful both to the authors, and it also is a modality which helps the editorial as well as the journal. For the author, it is giving a transparency, it is giving fairness, that where exactly his manuscript is at present, where it is getting stuck, so that he knows exactly what is happening to his manuscript over a period of time. Whereas for the editorial board also, they know we can have an auditing of our efficiency, along with, as you have said, Dr. Harish, that it can help us in getting the indexing as well as to know how this journal's functioning is happening if we can get the auditing part of that. So peer review is helpful. It has to be there both for the authors to have a transparency so that it gets fair for them where exactly their article is, and for the editorial as well as for the indexing agencies to know how this journal is faring in their review system and publishing right from the submission to the publishing of that article. So I think this importance of the review management or the manuscript central has also been clarified by my expert panelists out here. And that moves on and gives me the opportunity to go to the authorship issues. What I feel even now after 25 years of experience in getting this manuscripts and getting publications, the authorship becomes a very crucial and very contentious issue when you are submitting and getting your articles. So may I start about bit by Dr. Srinivas, how and what do you, is there any difference, if I may say, between a contributor vis-a-vis an author who is finally there on the manuscript which gets published, or both of them are same? And if not, what are the differences and how do you make a contributor to be an author?
Well, the contributorship and authorship, they are related, but they are distinct concepts, and they are often used to describe the roles played by the individuals within the team of creating the work. Authorship typically it refers to person or group of people who are responsible for the intellectual content of work. The ICMJE has a recommendation in 2019. There are 4 important points that have to be satisfied, and these are substantial contributions to the conception or design of the work, or the acquisition, analysis, or interpretation of data for the work. This I am reading from the recommendations. And drafting the work or revising it critically for important intellectual content, and final approval of the version to be published, and agreement to be accountable for all aspects of the work in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. So all these 4 have to be satisfied. So that there are 2 key things that authorship minimum, there are 2 minimum requirements, and these are a substantial contribution to work and accountability for the work. There's actually a chart that the Office of Intramural Research has produced. If you can see, the green part can be given authorship, and you can see all the green mainly in the design and interpretation of results and data acquisition parts of the work for the paper. Contributorship, on the other hand, it refers to the specific roles played by different individuals in creating a work. A contributor, all contributors may not be authors, but all authors will be contributors. So that is to put it in short. So a contributor is someone who takes part in something or makes a contribution. It could be financial, it could be administrative, a supervisory role, or a technical help, or supporting with figures and tables and data organization and things like that. So essentially, all of them need not become authors. Only if their contribution becomes significant, they become an author.
Right. So I would like to highlight the points which Dr. Srinivas has so properly brought out. That the one sentence which every person who is listening should understand is that all authors need to be contributors, but all contributors may not be the authors. And that's what we need to understand. And especially just mentoring of your authorship or mentoring your first author, as many of the people who are supposed to be doing that in the departments or your seniors, that does not qualify. I'll repeat, that does not qualify them to be the authors in that publication. It is that they have to have a substantial contribution to the drafting, design, right from inception till its submission. They have contributed substantially, then only an authorship can be given. And finally, I would say that it needs to be earned. It cannot be gifted just like that. So that's what I would say, because this is a very contentious issue and it is going to pester you right till your end, till the time you are publishing of how to. And that shows your management skills also, and making it clear to the people right in the before you start writing this, that who is going to be what and what is the role of every person who is involved in that. That brings me to the next question, and that is to Dr. Bhavuk, of how do you decide the chronological order of the authors? Who should be the first author? Who should be the corresponding author? And should all corresponding authors be the first author? Or vis-a-vis all the permutations and combinations which can happen? Professor Bhavuk, your ideas regarding this?
Yeah, usually it is a it becomes sometimes very tricky also. But if you look at the guidelines, actually they are quite clear. You know, like Dr. Srinivas also pointed out, you know, the first author is always who has, contributed the most substantially to the manuscript. Suppose we take an example of a thesis of the postgraduate, you know, which is the most common scenario. So obviously the candidate has done the most work, you know, whether it is the collection of the data, whether it is the drafting of the first manuscript and all those things. So that is usually done by the thesis candidate. So, however, not absolute, but usually the candidate should be the first author in such scenarios. And then the things comes about the last author. The last author should be the senior person, you know, who is involved in the overall study design and everything. And usually I feel in my this thing that corresponding author should be, if you are from an institute, then the corresponding author should be a regular employee of that institute, and it should be the senior one. However, it is not absolute, but this is how usually we look at the first and the fourth the author. In between, again it's very tricky, but again you have to see, you know, who has contributed most substantially. And obviously, you are going, it has to be decided before you start the research project itself, ideally, you know, that this will be the sequence of the authors. However, you can always look at the primary objectives and the secondary objectives. So the who is the person who was involved with the primary objective much more, then you can give him the second authorship. Who was involved with the secondary objectives, then you can give him the other authorships. Or some people have also given some mathematical formulas, like you can look at the manuscript paragraph, then you can look at the pictures, and you can look at the tables, then who have contributed most to them, and then on the basis of that thing you decide. But overall, it's a teamwork, and I think there should be no confusion from the start, because, you know, there can be arguments, in fact, later on also. After the manuscript is published, people can still argue.
Right.
But usually it is quite clear.
True. So remember that this is quite a contentious issue, and it becomes more and more in the final stages when your article is going to be published, when the people think that, yes, the rewards are now going to be distributed. So this needs to be decided right in the beginning so that you don't have any conflicts later on. I would again suggest that the corresponding author needs to be the person who is fully responsible and can take the overall responsibility of the entire manuscript along with the other authors' issues as well. He can take the responsibility. So that's what a corresponding author. He's more of an administrative value of a journal or a manuscript, and whereas the first author is the one who has done substantial or the most most important works and the highly work which has been there for that manuscript. That brings me to the next question regarding ghost versus gift authorships. And none other than Professor Harish, sir, you are so senior and you have been going through this for the last so many decades. You can give your guidance regarding ghost and gift authorships now.
This is something which no editor would like to have, but very, very common otherwise. Especially in a medical college or in a big hospital system where many people are there, and usually the senior people, they get guest authorship. Guest author is the one author who has not at all contributed, but he gets authorship. And the authorship criteria have been described very well by earlier panelists, but they have not contributed substantially. They are also not accountable, but still they get, by virtue of their position in the system, in the unit, in the hospital, in the department. This is one. And maybe gift authorship is also given to some junior persons also when they want to have some of the papers for their promotions, for their recognition by National Medical Commission. So all those things go on. This is absolutely unethical and should not be done, should not happen, but this is a common practice. And question is that what to do if editors recognize this happening. yes, editors have the power to ask to all the authors that what they have contributed. Just remind me one example that there was a case report actually. They have described how to ventilate 2% with one ventilator, and they have ventilated just 2 pair of the patients for 1 hour, and there were 20 contributors or 20 authors in this case report. So such things we can pick up very easily as an editor, and we can write to the corresponding author and what has been their contribution. A very small word about the ghost authorship also. There is something known as ghost authorship. It can be described in 2 ways. One is the person who has contributed substantially, person who is ready to take all the accountability, and the person is not given the authorship, or they are put into the contributor or in acknowledgement. This has happened with me also. I have contributed to some study. I was ready for doing anything, and my name was there in the manuscript. But this was some government-related program. Someone in the government said there are too many authors here. Remove them from this side. So it could happen. So both ways it is important. And another ghost thing, maybe the person who has not contributed and the person at all, and they also get it. Like ghost writers are there.
Okay. Right.
So sometimes they also get authorship, which is also not correct.
Right. Thank you, sir. Thank you for your wide opinion and the guidance regarding this. I would just move on to the next final summarization, because this is the thing that I would just like to summarize this panel, that always see the submission guidelines for the specific journal, because you need a pathway to get into that journal, and the submission guidelines provide you with that roadmap, how to enter that. Manuscript Help Center helps us to know the workflow of the journal as an author, and editorial board, it helps us to audit our own efficiency and the working. Authorship is a precious entity. Remember that it needs to be earned rather than gifted. It's a team effort, authorship, with due credit to the persons as per their contribution to the different fields. Have a checklist which is there in all the journals. Tick that and see who qualifies an author and who can be acknowledged as a contributor who has not given substantially. Thank you. I think I have overshot it by around 5 minutes or so, but it was a lovely discussion and interaction with all the authors and all the panelists out here. I would now hand over to Dr. Pooja for the next panel subsequently. Thank you.
Thank you very much.
Thank you, Dr. Vivek. It was a well-executed panel discussion. We had a good takeoff from your summary sheet. Now we go on to our next session, that is deciding title, research question, and hypothesis. For this, I will call upon Dr. Vineet Arora. Dr. Vineet is working with the DDU Hospital, New Delhi. He has more than 20 years of clinical experience. He is a Joint Secretary, DOA. He is a member of Editorial Board, JCOT, and Nodal Officer of Clubfoot Clinic. Over to you, Doctor. Before switching on to Dr. Vineet, I just want to make one announcement for our participants. Dear participants, you may put up your question through YouTube link of OrthoTV. We will take up all your question at 8:30. All our panelists will be there to answer your question. Over to you, Dr. Vineet.
Thank you, Dr. Pooja, for this nice introduction. Can I start sharing my screen?
Yes.
Yes. Yeah, I'm sure is it visible? Yeah. Thanks to JCOT as well as the Delhi Orthopedics Association for giving this opportunity to moderate this session. And this session, which is module 2 of today's program, is an important one, and which gives an idea about how to decide a title, research question, hypothesis, and introduction, including the gap analysis. So for this, and on behalf of Delhi Orthopedics Association and editorial board of JCOT, I welcome all the delegates as well as my panel of esteemed faculty from the various parts of the world. So we have got a panel which is comprising of Dr. Rajesh Bochu. He is working as a Senior Consultant of Musculoskeletal Radiologist at the Royal Orthopedic Hospital, Birmingham, in United Kingdom, and he is has the radiology training in the Leicester and the Norwich, and subspecialty training in the and the ROH and Birmingham Hospital. And Dr. Bochu has got a special area in the bone and soft tissue sarcoma, as well as a sports imaging. Welcome, Dr. Rajesh Bochu, to this panel. Then we have got a Professor Karthikeyan P. Iyengar. He is a senior consultant orthopedics with more than 150 indexed peer reviews articles in his name. And he is already an honorary professor at the Apollo Hospitals Educational and Research Foundation. And along with that, he has been a editor, deputy editor, and associate editor of many of the journals which are known to all of us. And he has a special area of interest is orthopedic trauma in hand and wrist. Welcome, Dr. Karthikeyan. Please join us. And we have got another panelist, Dr. K. Jayashree. She is presently working as a scientist at the National Institute of Epidemiology, Chennai. And she also had more than, she is a principal investigator of ICMR and USAID funded multicentric project. And she has more than 60 publications and authored 4 chapters in the textbook of the community medicine. And she has special interest in the tuberculosis and the comorbidities, healthcare for elderly. Welcome, Dr. Jayashree, for joining us today. And Professor Ujjwal Devnath is another panelist who has more than 30 years of clinical experience in joint replacement, arthroscopy, and spine surgery. And Dr. Devnath is a guide to the postgraduate trainees in the trauma and Embry Orthopedic Center. And Dr. Devnath has prolifically published more than 70 papers in many peer-reviewed journals. And he is a well-known orthopedic surgeon and working in India, Middle East, UK as a consultant, and has more than 3,000 surgeries in his name. Welcome, Professor Devnath. So before moving to our first question to Dr. Rajesh Bochu, if we see in the previous session, Dr. Bhavu Garg has rightly mentioned the title should be very effective. When we mention about the title, Dr. Rajesh, could you please elaborate whether the title should be having a very catchy title or it should be a straightforward title? Because nowadays when we see most of the people are having that time of advertisement, they are looking for the kind of advertisement and they are looking for the catchy things which attracts many of the readers, reviewers. What do you say about that?
Yeah, so the title is the key for any article. Most of the times, once they read the article, it can either be interesting or it can be straightforward. One of our panelists, Professor Karthikeyan, has developed a mnemonic called TRIPS. So basically what he says is that if the title should include the topic that the research is about, it should include the results. So whatever research you have done, a component of that should be included in the title so that when the reader reads the title, he gets an idea what it is about. If there was any intervention, for example, if the study is about surgical management or non-operative management or imaging features, the title should also include that. So that is I, and whether the type of population, whether it was a pediatric population, whether it was a sports person. So that's P. And the S is a study, whether it's a prospective or retrospective study. So the mnemonic that Professor Karthikeyan has suggested is TRIPS. And I think it's an easy way of including what the research is about in the title so that when the reader reads it, he can either think that it is of interest to him and go into it, or he can just go to the next article. One of the other ways is also, suppose if you're describing a new technique, you can use a similar concept and abbreviate it in the title.
Oh, perfect. I think that this gives an idea about a very clear idea as Dr. Karthikeyan has given some mnemonic. So now I will request Dr. Karthikeyan if you would like to add on something to this one.
Yes, thank you. So I found that mnemonic very helpful. However, you can also understand it also depends on the article subtype you are writing. For example, it is important to have these all 5 components in an original article, scientific article. However, if say, for example, you're writing a letter to editor or a commentary, a question may be quite appropriate. For example, chat GTP is quite popular in discussion nowadays. So you can say whether GTP is a friend or an adversary to academic publishing, and you can put a question mark, and that is a very catchy title. However, in a scientific article, original article, you should have all these components. You should describe the topic you are looking at. For example, this is my original article. It looks in the topic of interest here is COVID-19. However, specifically looking at a population of patients with hip fractures, which we had a lot of quandary as to how to manage, whether fixation is better, delaying surgery is better, and then the result is mentioned in the words clinical outcomes and characteristics. And I have also imparted there that it's a retrospective cohort analysis, because that was not a time where we could take a RCT. So all the factors, that is the study design, the population studies, the type of outcome we looked at, population, is mentioned in the title, and therefore the reader understands, okay, this is the type of article I'm going to go through. However, if it's a letter to editor, it should be a catchy title, concise, precise, attract the audience, and there you go after that.
Yeah, perfect. So that means the title should be catchy as to the editor, as the editorial team, and moreover, it should fulfill all the requirements, which is rightly given by Dr. Karthikeyan as a TRIPS, which includes T stand for topic, R stand for result, intervention, population, and S stand for study. Am I right, Dr. Karthikeyan? Would you like to add anything more?
No, yeah, that's perfect. Fine.
So, Dr. Hello. Yeah, Dr. Jayashree, would you like to add on something regarding the type of title, whether it should be catchy or it should be straightforward? I think most of the things have been covered by Dr. Karthikeyan.
Yes, I would just maybe add a public health perspective to it. When we publish in public health, we generally, all these elements have to be there. And when we look at reporting guidelines across different study designs, say consort or strobe, all these have specific requirements of how the title should read. But that doesn't underestimate, the power of a catchy title. Like when we worked with MDR TB patients, our title read when treatment is more challenging than the disease. That kind of picks the eyes, and it also depends on whom you are targeting. And I believe that most international journals, the highly reputed ones, give you a lot of space to play with the language. There's no more that very hard and fast line between scientific writing and creative writing. You could exercise some creative liberty when you come to the title. Yeah.
Perfect. But do you think that the kind of example which you have given in the public health sector, so like, do we really get these kind of titles which are covering whole of the perspective as suggested by Dr. Karthikeyan?
So we take the liberty of having two parts to the title, like Dr. Karthikeyan's example also. If you see, there are two parts. There is there is the initial part, characteristics and clinical outcomes, and then there's a colon, and he says a retrospective cohort analysis. So our title here read when treatment is more challenging than the disease, which was actually a verbatim quote. It was a mixed method study. So that was actually verbatim said by a patient. So that is there, and it is followed by a mixed method study among MDR TB patients in this place. So it did have all the elements that, Dr. Karthikeyan has listed. We did specify the population. We go one step further and give, where the study was conducted. All this is still there in the title, but still the first half, you can take the liberty. Not always do we resort to that. Sometimes we also go with very boring titles where we stick to the, PCOT form, which I believe that you are, is coming up in the discussion.
Yeah. Dr. Rajesh, don't you think this will become a very long title if we are using a mix-up technique, like we are giving some catchy idea also and including this mnemonic of TRIPS?
No, I think it just summarizes what the article is about, and the reader, it will be easy for the reader to analyze whether it's of interest or not.
Perfect. So the message should be like it should include everything from beginning to the end, and it should be catchy as well. Am I right? I think the panelists will agree to that. So with that, my next question with Dr. Ujjwal Devnath. So there is a vast information available for about a particular topic. So how to choose what to go into the introduction? So that's an important part of the introduction. And if you just see, these things are very important in our scenario when the youngsters, like a postgrad student who's writing an article or manuscript, then he takes it to his associate professor, then additional professor, and then and so on. And then he gathers lots of information, but he doesn't know how to write an introduction. So could you please elaborate what are the major points which you are going to discuss for the how to put the information particularly in the introduction?
Hi, can you hear me?
Yes, perfectly, sir. Loud and clear.
Okay. The introduction actually needs three important things. It should have the interest of the reader, number one. Number two, the background of the topic should be appreciated by the reader. Number three, the thesis statement that clearly and quickly summarizes your main points. So with these three issues, we would like to introduce, short and very precise, concise introduction, which should have the topic of interest, provide a background, and position my approach in the background where I am in this today's research question, and details of the specific research problem and the problem statement, followed by an overview of the paper structure, whether what am I going to do. So this is just be the precise introduction. It should not be go on and writing about the whole thing. Just about precise in one paragraph. If you can write the introduction to what am I doing, and also include what kind of a research question is that, descriptive or correlational or experimental, or whatever types of researches that are available. So one should be able to say that in the research, in the introduction. And the next question is about the research gap in the literature related to the research question.
So
that's the most. Oh,
yeah,
you
so
want to only
We'll come later on to that question. So, so that means you means the introduction should be very precise, and it should be including all these 3 points, and which we would love to include, and just even the author should be able to give a clear-cut message to all the readers. And what exactly, like as I said, if we give an example, because most of the medical colleges and all the thesis paper works are being written by the postgrad student, so they have got so much available on the internet. So they have got so many articles available. So Dr. Karthikeyan, can you give some kind of tips for that? Which particular things they have to include into introduction, or which they can easily overlook?
Yes. So the introduction is the main part that lays out your study. So the words, 2 key words I use when you write an introduction is called gap analysis. What do I mean by that? What I mean is, when you start writing the introduction, why is this topic important? For example, Dr. Wang said pedicular screw in spine fixation. Okay, there are so many articles written on that. Or distal radius fracture, volar plating. There are already so many articles. So when I am trying to conduct a study, I need to point out, okay, the background is volar plating is already used for distal radius unstable fractures. But I am looking at particular thing. So look at what has already been published in literature, what has been discussed, what issues have been debated, what issues have not been resolved, and what is the future direction, and what is my study going to add to the current literature. So it is important to find out the gap in knowledge in readership, authors, scientists, everywhere. So find the gap, address the question, debate the literature, what has been given, and then lay out your question. So the final sentence of your introduction should be, this study therefore tries to explore this, find this, or investigate this. And then that is the end of your introduction. More importantly, it should have about 10 to 15 PubMed references of what you have searched in literature that supports your debate, that supports your research hypothesis question, and lays out your study. So gap analysis are the 2 key words I would say.
Perfect. So that means the gap analysis gives an idea about where are we right now, I mean, and where we need to go in the research and what we are looking for in future, so that my research will lead me to that. Dr. Jashi, would like to add on something with this, as Dr. Karthikeyan has mostly completed their part of the introduction?
Yeah, just quickly, relevant and recent is what we say. Go for the relevant references and the recent references. And the other one is, along with what Dr. Karthikeyan mentioned, it's also great to mention why that gap has to be addressed, because that is what funders want to know. That is what readers need to know. You found the gap, but why is it essential? We can live with uncertainties, but why do you want to fix this gap? And then, like he beautifully mentioned, the last line sums up the objectives of the study. Therefore, I want to do this. Over to you.
Perfect. Thank you. So that leads me to the next question. How to avoid plagiarism? Dr. Ujjwal Devnath, recently you have heard in the previous session, Dr. Bhavuk has again repeatedly said, and there's a lot of plagiarism while writing an introduction, and students like they have been picking up few words from article and they're compiling their introduction with that one. So are you in position to give them guidelines how to avoid the plagiarism in the introduction?
Yes, of course. I can. What it is in plagiarism is the most important issue in most of the papers, that's because there are multiple papers that are available on one topic. And so people can continue to visualize in the net and find out about the sentences which they are introducing in the introduction. But they do not know that this can be checked in the good plagiarism checker, and it would be absolutely, the value of the paper will be diminished. So number one important thing that has to be in the introduction is the site, the source of your line, what you are writing, and also paraphrase the line in your own words. That is very important. And also exclude any important lines or the words that are being used in the different paper. So those has to be paraphrased in your own idea. So that has to be important. And then include the quotations. If you have using a quotation from one paper, just include it in inverted commas. So then mention that this is the citation of that quotation. And finally, you should use a plagiarism checker, which is very important because there are multiple plagiarism checkers available nowadays. So every time you write a paper, you should put that back in the plagiarism checker and see how much is the corrections required in your introduction or whatever the whole paper. So around 15% is acceptable in most of the journals. I think 10 to 20% is the approximate rate, and 15% approximately is required. So beyond that, I think no journal will accept that. And so some words like is, for, at, they are acceptable by most of the journals, those prepositions and adjectives. So one can use them as far as they can paraphrase the singular lines from the different articles. So this is what my idea in checking the plagiarism would be.
Perfect. So that means by doing paraphrasing of the article languages which we are picking up from various articles, that will help us in reducing the plagiarism. Am I right?
Yes.
Yeah, perfect.
Absolutely.
Dr. Rajesh Pachu, would you like to add on something with whatever the Dr. Ujjwal has given an insight about it?
The only thing I will add is that because of ChatGPT, which will automatically write the articles for you, you have to note that the articles that are written by ChatGPT will not be picked up by the traditionally available plagiarism tools. Your iAuthenticate, your Turnitin and all will show that there is no plagiarism. And in fact, we have just submitted a paper and we have shown that out of the 5 articles written by ChatGPT, majority are fake. All the 99% of the references are made up and don't exist. So you have to note this fact. ChatGPT is going to change everything. So what is important to note is that in future, there will be a new type of plagiarism tool. But in the current circumstances, the editorial board and all the major publishers are trying to gear up their resources to ensure that they can identify the articles that are done by ChatGPT. So that is the only thing I will say.
Perfect. I think that thanks for giving an insight about the ChatGPT. I think this is something which is going to change the line of working of the most editorial board. like even if the good checker of the plagiarism will not be able to check it, it will be very difficult for them, and the job becomes more and more difficult. Dr. Karthikeyan, do you want to add something with that? How to avoid plagiarism in the introduction? And especially in view of ChatGPT, how you like to avoid? And do you have any idea?
Yes. So the ChatGPT introduction as an AI tool is really a concern. So because there are all easy way to get people writing essays, their background, but this most important thing a ChatGPT as a co-author ignores is accountability. An author who has submitted an article as a corresponding author, as a first author, has to be accountable for all the literature that goes into there. So unless we strengthen that process and be accountable as authors, I think that is going to be the key issue going forward.
So that is a message for all the authors that they should be more accountable regarding their own publications.
Absolutely, Peter. Yeah.
Okay, that leads me to another question. Dr. Karthikeyan, to you only. How do you formulate a research question?
I find the PCOS acronym or synonym very easy to follow. So, for example, if I have to look into volar plating of distal radius or IMHS or DHS for hip fractures, I already know the introduction, I already know the gap analysis, and then I formulate this, the criteria of PCOS, which stands for, again, population, intervention, then you need to have a comparator and look at outcomes. And most finally, what has the study got and type of study it is. So you need to have the best possible evidence that you can generate or you can submit or you can produce is when you have the essential intervention already in place, and then compare it to the gold standard or the standard that is your current practice, and then look at outcomes. But the outcomes should be a mixture of clinical outcomes, radiological outcomes, subjective, objective, and then you have to find the appropriate study design for it. Most importantly, when you formulate the research question, it should have a clinical implication on what we are trying to show or what we are trying to do. Because in the end, writing articles, research scholarship, we are doing it for improvement of patient care. So it should have a clinical implication. That's the way I would go about it.
Yeah, I think you are talking about PCOS. So that mnemonic PCOS will be very useful for us. I think if we say PCOS is rightly said, like P stands for population, I is for intervention, C for control, tool or the context, and O is outcome of interest and study design. Am I right, sir?
Absolutely. I think Srinivas has his hand raised. He may have some ideas.
Okay, Dr. Srinivas, would you like to add on something with that? Kindly unmute yourself.
Sorry, this is about ChatGPT. Actually, it's actually a bit interesting. I feel it's not authentic, the information from ChatGPT. It's an artificial intelligence software, and it's still learning, so it's not fully evolved. I did a short search on my name actually, and it showed a wrong address. I mean, wrong. I'm fairly certain that there's no orthopedic surgeon with my full name in Andhra Pradesh, but the output it gave had inaccuracies, which I had to rectify by telling it. When I said I did not do my undergraduation and post-graduation in Andhra Medical College, it rectified. It said, sorry, it is an error. I have rectified it. So I think we should not take whatever comes out of ChatGPT as authentic, and it should always be counter-checked.
The editorial board has to be very sincere about it. Anything coming from the ChatGPT should not be entered into that. Coming back to Dr. Karthikeyan again. So we were discussing about the PICOS method, PICOS criteria. So would you like to give some more insight about that? About research question template?
Yeah, it's a standard template that is being used now. More importantly, we are using this in clinical trials. If you see, there is a lot of clinical trials going on. So, and this is a very easy way of initiating a randomized control trial. Because remember, the gold standard for publishing is RCT. But why does a RCT become gold standard? Because it removes the selection bias. Therefore, it has to have an intervention arm, experimental arm, and a control arm. And that makes it very easy. So when you are thinking about a topic, you need to think, okay, I'm doing this intervention, but what is the control I'm going to see? And then obviously all the study will depend on your outcomes. What outcomes are you evaluating? And that will have clinical implication. And therefore, the study design comes into that. Obviously, the population is also important depending on which age group you're looking at, whether we have a large RCT going on pediatric Sufi and Perthis, but we also have a large cohort or RCT going on multiple other things, for example, hip fractures, and they are randomized, and therefore this type of mnemonic helps to understand that. More importantly, when you are critically appraising literature, as a reader, if I want to read an article 10 minutes, this is a construct. Okay, I can look at what population did the authors look at, what was the intervention they looked at, what was the comparative they used at, what was the study design, and what were the clinical outcomes. So as a peer reviewer or a critical appraiser, I can make my ideas very clear, come to a concise, and then write a peer review report. It's also important when you're talking in a webinar. You can say, I've reviewed this article. This is the population they explored. This is the intervention they used. This is the comparator they compared with. And these are their clinical outcomes. And then look at the implication in practice. That's how, I think that's why it's very useful.
Perfect, perfect. I think that mnemonic PICOS will be very useful for I think coming generations as well. So Dr. Jayashree, I think there's another criteria for formulating a research question that is coming by mnemonics of FINER. Would you like to give some idea about that?
Sure. Thank you, Dr. Vinit. So quickly, FINER criteria is not as objective and hard and fast as what Dr. Karthikeyan had said about PICOS. This is more of a subjective criteria where you can, once you have the research question, you need to look at these criteria and see whether your research question fits this. Moreover, your funder will look at it from this angle. I'm sorry about bringing the funder angle, because most often scientific writing, we have to understand it also includes protocol writing or proposal writing. So what we write needs to be appealing to the funder also. So feasible. So something that you propose, it's not all rocket science, or even if it is rocket science, you have to demonstrate it is feasible. Innovative. It has to be something new. We are not, it's something very original. Again, novel, not very different from innovative, but something very, very new. You're not reinventing the wheel. You've come up with something very new. It's ethical. Now that is non-negotiable. You have to, very clearly put it out there that it is ethical to do whatever you're setting out to do, and relevant, something that is, the need of the hour, something that is really going to have policy implications, or something that is going to change some clinical guidelines. So briefly, that is FINER criteria. So what is feasible in your eyes may not look feasible in my eyes. So that's why I said these are subjective criteria. But it's always good to run your research question through a FINER lens also. Yeah, over to you, Doctor.
Yeah, perfect, Dr. Jayashree. I think that is very, I think what you want to say is that your research question should be fit into the FINER criteria. And as well as Dr. Karthikeyan is saying that his formulation of research question is through the PICOS criteria. But what I mean to say is, like, if you apply the PICOS, you can formulate your question. And then if the question is already formulated, then you can always put into the FINER criteria. You can just verify whether it's useful or not. Am I right? Am I right, Dr. Jayashree?
Yes, PICOS is more about the structure of your title or your question, whereas FINER is more about what you're setting out to find out in your research question. Yeah, you're right.
Perfect. But just could you just elaborate us one thing? Like when you say feasible, what is the meaning of feasible in this one?
Feasible is given my limitations of resources in terms of time, manpower, availability of study participants and all this. Whatever I propose must be something that is doable. That is what we mean by feasible. Yeah.
All right. They should have adequate number of subjects. They should have manageable resources, as well as they should have time and
yeah.
Okay. That's very good. It should be most of them. It should be ethical as well, because it should be approved by the IRB committee of your institution. Thanks a lot for giving this input to us. So now that leads to the next question to Dr. Rajesh Baju. There is always a doubt, even to me also, to till date, that what is research question or what is hypothesis? Are they both are same, or why? If there's a difference, what is that?
In my opinion, research question or hypothesis is something based upon gap analysis, where something that has not been looked into is identified. So there is a clear-cut overlap, but irrespective of that, in the introduction, the aim of the study should be included, and in the form of either a research question or hypothesis. And the reader should know that this is the gap that we are aiming to answer.
No, that is fine. But is there any clerical difference by definition, or like can we enumerate something which is different, which is making a research question different from the hypothesis? Or can we say they are alike?
Could I, if it's okay, Dr. Rajesh?
Yeah, carry on.
Yeah,
thank you. Dr. Jayashree, just a second. You can carry on with that one, please. Yeah.
Yeah.
Dr.
So, yeah, like Dr. Rajesh said, there, practically it's not always relevant to have, this as a research question and hypothesis, but a research question generally need not have a direction, whereas a hypothesis has. Whereas, like, let us say you're looking at a certain intervention, say, a hormonal contraceptive or hormonal pills in postmenopausal women and hip fractures. Now, if this is my exposure and outcome, my research question may simply say, what is the effectiveness of hormonal pills on hip fractures among postmenopausal women, whatever age group and all that. Whereas in my hypothesis, I would try to establish, hypothesis is nothing but an educated guess. I've looked into literature and I have some idea whether these pills are going to reduce hip fractures or they're going to increase the incidence of hip fractures. So that is where a hypothesis comes. I am hypothesizing that if you put postmenopausal women on hormonal pills in this dosage for this duration, it reduces the incidence of hip fractures in them. So there I am giving a sense of direction. And even in hypothesis, we have something called null, where we say there is no association, no, whether women take hormonal pills or not, there's no difference in them sustaining hip fractures. Whereas an alternate hypothesis, I may or may not give a direction. So I say, when you put women, postmenopausal women on hormonal pills, it reduces the incidence of hip fractures. So a hypothesis is more of an educated guess, and it generally has a direction. But this interesting thing, what Dr. Rajesh also mentioned, is both of them may not make it into your final manuscript. A research question put as a statement is the aim of your study, and hypothesis is we generally encourage researchers to write it down so that you know what is there in your mind. And because you're always working with the team, you need to know, you need to let everyone know that this is what you have in mind. This is what literature, based on literature and based on your expertise, you come up with as a hypothesis. Over to you.
So do you want to say like it's a hypothesis is something where we have some data previously available to us and which we would like to elaborate, or we want to research on that one, and it has some quantity, it can be quantified, and it's more useful for the scientific researchers as compared to the other subjects where we can use the research questions?
I would beg to differ, Dr. You need not have a quantity or an association already established. And almost always, we are all not in, unless we are into genetic research or something where no study has been done about that, we are almost always starting off with some background knowledge. There is something already known about it. We're just further refining that knowledge. So based on what you know, and even if there is no knowledge, the reason you're starting out with a research topic is because you have a hunch in your mind. You've been seeing patients showing a certain characteristics. Say you discharge them on the 5th day versus you discharge them on the 8th day. You think there is some difference to a certain outcome. So there is a certain background from where your hypothesis is coming from. It could be literature. It could be your observations in the clinic. And that's why I'm saying it's an educated guess. You need not have quantities or associations or effect size measures to justify it.
Perfect. So, Professor Devnath, would you like to elaborate just something further? What Dr. Jayashree?
Well, as Jayashree has already clearly stated everything, mention if it's an educated guess, the hypothesis, that means it's a predictive statement about the relationship between two or more variables, right? So this cannot be related to the research. Research is
Hello. Dr. Devnath, I think there's some internet issues there.
Dr. Vineet, we probably also need to wind up because we are running out of time.
Yes, yes, sir. So final word from Dr. Karthikeyan about this, then we'll wind up the session. Dr. Karthikeyan, can you have the final word about this?
No, I think everything has been quite succinctly put, really. Nothing more to add.
Okay, perfect. I think the section was quite educative to all our presenters as well as for the delegates. And we have gathered a lot of information about what to include in the introduction, how to make our title, and what is the difference between the research question and hypothesis. And I thank all the panelists for giving their valuable time. And I thanks the organizer of JCOT editorial board for giving this opportunity to us. Thank you very much. Over to you, Dr. Pooja. Dr. Pooja is the moderator for the next session as well. So may I give a brief introduction to Dr. Pooja? Dr. Pooja is a PhD scholar and she has earned a PhD from the National Institute of Immunology, Delhi. She has already worked with the institute like DRDO and NIPER, as well as had a lot of R&D experience of 15 years and more. And she is presently with ISIC and a recipient of ICMR grant for a project Pressure Ulcer on Healing. So, and she is currently member of editorial board of JCOT as well. And she has a special area of interest in the biomedical and the regeneration, wound healing, and the skin regeneration. So with this, I would request Dr. Pooja to take charge and start with the new session. Thank you very much. Over to you, Dr. Pooja.
Thank you, Dr. Thank you, Dr. Vineet.
I'll stop sharing. Yeah.
I will share my slides now. I believe everybody can see my slide.
Yes, we can.
Yes, we can.
Right. I'm thankful to JCOT and DOA for providing me the opportunity for moderating this session. This session is about abstract writing. Our panelists are Dr. H.S. Chabra, Dr. Amit Awasthi, and Professor Karthikeyan. Just a brief introduction to my panelist. Dr. H.S. Chabra is a medical director at Indian Spinal Injury Center. He is immediate past president of ISCOS. He is the vice president and Association of National Board of Accreditation of Institutes. She has many accolades to his name, like 12th National Excellency Awards, ISCOS Society of Medal Award 2013. He's editor-in-chief of for JCOT. He was editor-in-chief for ISCOS test book. He has written many articles, and he has 145 peer-reviewed journal to his name and 24 chapters in the different various books. Welcome to Dr. Chabra.
Thank you, Pooja.
Our next panelist is Dr. Amit Awasthi. Dr. Amit is presently a senior professor at THSTI Faridabad. He has more than 50 publications in a high-impact journal. Dr. Amit has contributed to COVID-19 pandemic national emergency by establishing animal model. He has received many awards and fellowship like CDRI Award, DBT Bioscience Award, GP Talwar Award, and many more. Welcome, Dr. Amit. Dr. Amit, are you there? Let's go. Next panelist is Dr. Karthikeyan. He's a honorary professor at Apollo Hospital and Education Research Foundation. He's a senior clinical lecturer at the Edge Hill University, UK, and deputy editor JCOT and assistant editor of JO. Welcome, Dr. Karthikeyan. So, initiating with our session, our first question to my panelist is, panelist Dr. Chabra, why are abstracts so important and what is the significance of the abstracts? Dr. Chabra, this question put to you.
Thank you, Pooja. We know that abstracts are designed to highlight key points from major sections of the manuscript and to explain what the paper includes. Actually, an effective abstract provides sufficient details to expedite classifying the paper as relevant or not relevant to the reader's clinical work or research interests. So we can say that an abstract is a very useful tool to grab the reader's interest through concise, informative summary. In fact, it is well established that articles which feature accurate, informative, well-written abstracts are more likely to be read, shared, and cited. So, in other words, probably I would not be wrong in mentioning that an abstract is one of the most important components of a manuscript. Thus, its importance. Right.
Yeah, thank you, Dr. Sabra. Other panel, Dr. Karthikeyan, would you like to add something to it?
I think he has summarized it well. Abstract is a front door to any article. It should be concise, lay out your study, and depending on the author guidelines should be appropriate types. There are various types. We'll probably come to that.
Right. Next, let's move to next question. My next question is to Dr. Karthikeyan. Are there different type of abstracts, and what is the benefit of one type of abstract over the other?
So the answer to the first question is yes. So depending on the type of articles and the journal guidelines, there are two main traditional ones. And these traditional ones are either a structured abstract or unstructured abstract. However, the newer coming one are something called as visual, graphics, or infographic abstract. They are a graphical representation of abstract. The two traditional, the difference is a structured abstract has particular subheadings that we need to elaborate as we write the structured abstract. However, the unstructured abstract is just a paragraph. There are various criteria in the word limit, the use of parentheses, syntax, grammar, abbreviation, and therefore that makes it different. But I feel a structured abstract for an original article lays out your study better. It invites the reader, it invites the EIC, it invites the EIC to see, oh, whether the layout is good and can I send it to peer reviewer. And when the editor reads, it's the first thing that a reader reads. Therefore, it catches the reader, and then he or she will go on to read the whole article. Therefore, I feel structured abstract is much better than a traditional unstructured abstract.
Pooja, before you go on, could I ask Dr. Karthikeyan, are there any advantages of an unstructured abstract? For example, an unstructured abstract may be more descriptive, may give some more flexibility to the authors. And thus, if there are some studies which cover a wide range of topics or have unconventional methodologies, maybe unstructured abstracts could help the authors, or they may be more useful there.
I agree. If they are more relevant for case reports or narrative reviews, where there is no study hypothesis specifically. And therefore, you can have a paragraph which just lays out your idea of writing the narrative review or a case report, saying this is something rare we have found and we are going to describe. And there, in those situations, an unstructured abstract is appropriate.
So may I add something onto it?
Yeah, sure, Dr. Amit.
Yeah, so basically what Dr. Karthikeyan and Dr. Chabra has mentioned. So before 1980s, most of the article were having unstructured abstract, and the primary difference between the abstract unstructured and the structured abstract is lies the type of journal or type of question. Like for example, if your question is actually hypothesis driven, which is primarily done in most of the clinical research, and if you see the clinical research, the paper published in NEJM, for example, or Lancet Infectious Disease, you clearly see there is a hypothesis, and therefore there's a kind of structure, the background information, the methodology, the discussion kind of thing is in different categories. But if you see a kind of basic research journal, for example, Science or Nature, this is more towards unstructured abstract, where the author is having a leverage or liberty to use this, let's say, 200 words a paragraph to define what is the question, what is the gaps, and what they have identified. So basically, if you broadly divide structure and the unstructured abstract, one is more toward basic sciences and other one is toward more clinical sciences. Thank you.
Pooja.
Thank you. Next, basic research abstract. Yes, sir.
Yeah, please go ahead. Please go ahead. Yeah. I think we are losing Pooja in between. I could carry on till.
So my
Pooja
next question is in the abstract to.
Yeah, I could carry forward till Pooja gets her connectivity back. So the next
Sir,
question.
can you hear me?
Yeah, we are losing you in between. So I'm going on to your next question. Yeah. So the question is, if we break down an abstract, what should be the ratio of words in each section? I think Pooja wanted to address that question to me. I would want to point out that writing an abstract is not an easy thing. In fact, writing a good abstract holds the key to the manuscript, because you need to summarize everything within that abstract. They say generally, I would quote, that writing a great abstract is an art, right? But writing an abstract within the word limits is science, right? So you need to, most of the journals give a word limit to the whole abstract, and we need to confine ourselves to that. They generally would mention what are the headings within which the abstract need to be extrapolated within a structured abstract, but they do not give a division of how many or the word limit for each subsection of the abstract. One needs to have a balanced distribution of words within each section in order to provide a comprehensive information. So one should not have too many words in, for example, the introduction or the background, so that you don't have enough words left for the remaining. In general, I would want to say, depending on what is the total word limit for the abstract, which varies from 150 to 300 words, an introduction or a background of around 40 to 50 words, an objective, say, of or aim of 30 to 40 words, a methodology of, say, 50 to 70 words, results within 75 to 100 words, and conclusion within 30 to 40 words would make a balanced abstract per se. But you can't go by this rule always. You need to have a fairly balanced abstract which gives a comprehensive, well-balanced information. Over to you, Pooja.
Thank you, Thank you, Dr. Chabra. Can you hear me all?
Yeah, we can hear you. Yeah.
Thank you, sir, for clearly mentioning what exactly are the time word limits in case of abstract. I will go back to question number 3, and I'll put this question to Dr. Amit. What should be emphasized in an abstract to enhance its readability? Dr. Amit?
This is a, can you hear me?
Yes.
So this is a very important, aspect of abstract writing. In fact, abstract, if you really see the abstract, this is, as Dr. Chabra said, is the most important part of the manuscript, because that actually defines, because when you submit a manuscript, these editors are so busy, and I get a lot of papers, so I don't have time to go through the whole lot of data. What I try to do first is go to the title and then go to the abstract. These are the 2 key points, and that actually decide at that time that whether this paper is good enough to go for the next round of review process, because everybody is busy nowadays, and whole lot of journals are publishing so many papers. So I think that become more critical, and that brings you the kind of what should be emphasized in the abstract, right? So in the structured abstract is clearly defined what they want. They want an objective, a background, the methodology, the discussion, and the final outcome, right? So within these words, under these headings, you have to define your abstract. What Dr. Chabra very nicely articulated the kind of words you have to put in each of these sections. But there is no such kind of guidelines there, right? That you have to do in kind of this way. You can play around little bit, some few words lesser there and a few words more in other section. So the most important part of the abstract that you have to summarize in a lay language, in a kind of scientific, but a kind of lay language, in a way that it become more readable to the audience, right? So then you have to define what exactly you are actually describing in the paper. And then the gap analysis, why it is so important. And then the previous, knowledge, available knowledge in the literature. So then you have to structure it in a way that, what is the knowledge, what is the gaps, and what is the hypothesis, and then what are these methodology, the new techniques have been used to address the hypothesis in the question, or the question in a kind of very scientific method. So these are the few points which is important and which actually enhance the readability of an abstract. I hope I answered this question, and I will be happy if Dr. Chabra or Dr. Karthikeyan can add something more onto it.
Dr. Chabra, would you like to add something to it? Dr. Karthikeyan, would you like to add something to it?
Dr. Chabra, you're muted.
Yeah. Sorry. Just to reinforce what has been so well articulated before, I think a good abstract should focus on the main objective, should use clear and concise language, should highlight the main findings, should provide context and background, that's to start with, and should stick to the word limit. So I think this provides a good readability per se. So that's all. Dr. Karthikeyan?
Yeah, I would add a couple of things in that. Make sure your grammar is correct, syntax, don't use uncommon abbreviations, don't input any videos, embed any videos, any table, figures. So all the structured abstract have guidelines. Stick to the guideline of word limits, especially respect the grammar, English, full stop, syntax, etc. And there you lay out the study.
Thank you, Dr. Karthik. We'll move to next question. Fifth question already answered by Dr. Amit. So in the interest of time, I'll go to sixth question. My sixth question is to Dr. Karthikeyan. What do you think about the visual abstract? It is now very upcoming in these days. Many journals ask for graphical or visual abstract. So what is your current take-up in the present scenario?
I think visual abstract, or the other names, infographic, graphical abstract, are the upcoming things. It is, as everyone has pointed, we have time limit on our hand. We can only read so much, see so much. So a visual abstract is a graphical way or a pictorial way of describing what you have written in text. So it's an easy way to disseminate research. It has three important criteria, I feel. Number one, when you are deciding the hypothesis, you can know the structure and then you can put it there. Then the main three outcomes and the study design, you put it in the middle. And therefore, when you disseminate, apart from the traditional databases, H-index, citations that we depend on the written articles, nowadays people are more used to social media, blogs, TV, etc., etc. So there is a new score that has come up that evaluates your social impact of your scientific article, and that is called the altmetric score. So a lot of journals now score you on the altmetric, how popular the article is. And for that, you need a graphical version. Because remember, as humans, we take longer to read text, while visual impression is very catchy. You can read it in a blink of your eye. And therefore, I think this is the way to go forward.
I fully agree with Dr. Karthikeyan. I think Dr. Chhabra also has, put up in JCOT also that we are asking authors to submit their graphical abstract or visual abstract so that that can be put up in Facebook and Twitter handles to promote research to larger audience and put up greater impact on the audience. So would you like to, I request other panelists to, if they wanted to add up to this.
So I think Dr. Karthikeyan has very nicely, articulated the point. So visual abstract, it was not very popular in the past. And what, I can say from the terms of basic research journals or basic science journal, where we used to have a last figure as a summary figure, where we draw a kind of cartoon or some sort of graphical thing of whole article, because the readers doesn't want to, the readers from different field doesn't want to go to the nitty-gritty of your science or the kind of terminology. So they want to just see the overall concept what you addressed. So however, over past few years, what we have actually started is started noticing, particularly the journals of Cell Press, the Cell journal, Cell or Immunity, and those kind of journals where they have started a graphical abstract. But the problem with the graphical abstract is you can catch things very quickly if you are from kind of relevant field. But if you're not from a relevant field, but you're still interested to understand the field, then you have to certainly go for the reading those 250 words or 300 for the abstract. But from the point of view of science communication, like Twitter handle, social media, which is now very popular. In fact, any good paper published, then these journals themselves started putting this graphical abstract on their handles, Twitter handles or social media, so that the readability of those articles increases. And then based on the readability, you can go into arithmetic, how many investigators have seen the paper, and that actually gives you kind of the popularity of the topic, and that actually decide the grant of funding agency to which area to fund. So I think this is a whole lot of thought process has gone into the putting a graphical abstract. But the gold standard is still for the scientists gonna remain is the 250 or 300 words abstract. This is what I wanted to add. Thank you.
Agreed, Dr. Amit. Well said. Definitely, we cannot eliminate the normal the word abstract, but graphical abstract definitely can bring more audience to you. Let's move to next question. My next question is to all the panelists, because all of you are reviewer and at editorial board of the respected journals. So what are the most common glitches you come across in an abstract when you review an article? Or what are the pitfalls that an author need to avoid in writing an abstract?
So if I just want to, if I may want to add to your question number 6, obviously the first thing as a reviewer or as a handling editor, we would like to definitely see the overall structure of an abstract. You know, it should not be like you started something without giving a kind of 2-line or 3-line of background, or after that followed by the 2-line or 3-line of kind of gap analysis, right? And then you start describing your finding, why you asked this research question, and then you describe your finding. This is kind of overall things what I as a reviewer or as a handling editor like to see. The second thing what Dr. Karthikeyan has mentioned in his previous discussion, that the other most important thing what we like to see, because most of these journals are kind of English journals, right? So the kind of grammar, the syntax, the uses of unnecessary words, like for example, interestingly, I see a lot of people use the word interestingly, we found this, right? This something like, unnecessary words, because sometimes these authors try to put their emotions into the abstract. And let me tell you, the scientific writing is devoid of any emotions. The scientific writing is completely rely on the observation, and that has to be present in a way that without having and putting your own emotions into it. So this is what I wanted to add to this point.
Dr. Chabra, your comment, please.
Yeah, I think very well summarized, but I would just want to add that sticking to the journal guidelines is a very important part, not only for the whole manuscript, but also for the abstract. So this is a glitch which is often faced while reviewing the manuscripts per se. Also, making unsupported claims means if the claims are there which can't be supported by your study, that is another glitch which is generally there. And not highlighting enough the significance of the study is also another aspect where many manuscripts and abstracts lack. So these are three of the general glitches which are there. And of course, as mentioned before, failing to proofread your manuscript appropriately, including too much jargon, not sticking to the right length of either it's too short or too long, and not including all important information or other aspects.
Thank you, Dr. Chabra. It's a very important point that we need to emphasize the significance of the study. Dr. Karthikeyan, would you like to add something to it?
No, most of it is covered, except I would say 3 things. In the methodology section, if you are doing a study, mention the primary outcome you're looking at. Mention the secondary outcome you looked at. Then the second thing is have an effective conclusion that should answer your aims or the study hypothesis. And third thing is never forget to use mesh keywords, because that's how your abstract is going to be looked into by other researchers, authors in databases. So you should have 3 to 5 key mesh keywords. I think these are the 3 things I would add.
Thanks, Dr. Karthikeyan. I think my next question is again the same thing which you have right now mentioned. So what is mesh keywords and how are they important? So Dr. Karthikeyan, you elaborate?
So mesh is a short form for medical subject headings. What it implies is when you have keywords, whenever you want to search for a particular topic, you can put that keywords into the mesh website and get to the appropriate articles. So it's a way to find your related articles, search databases, search internet, so that you get reference articles for your study. And that helps you while you're writing up your introduction and then debating the literature in your discussion section. So this is a key component because it will enhance your article when it's published because you have used the appropriate keywords. It's for people to search databases. That's the simplest way I would put it.
Thank you, Dr. Kathan. My next question, and in the interest of time, last question. So what are the tips and tricks for writing a scholarly abstract? Dr. Chavra, quickly, can you if you could put down questions?
I think we need to summarize the whole panel discussion to come to this. As has been very appropriately mentioned, it should summarize the whole important information, should be of the appropriate length. There should not be too much jargon. We should adhere to the journal guidelines. We should make substantiated claims on only the highlight. We should highlight the significance of the study. We should not fail to proofread. And as Dr. Karthikeyan very rightly said, the conclusion should match, should be able to give what your study concluded with regard to the objectives per se. And very often, if the conclusion is not appropriate, you are not right here. I'd only want to say that the abstract should be left to the last, and it should be not lifted from within the article. It should be written afresh. Otherwise, there will be you will not be able to do good justice to the abstract per se. That's it, Pooja.
Thank you, Dr. Chavra. Dr. Karthikeyan, would you like to add something to it?
No, that summarizes the session really. Yes, explained everything.
Thank you to all the panelists. Just summarizing this one slide, that abstract is a landing page for your research article. Do a good justice to your abstract. We learned about structure, unstructured, and visual abstracts, and the importance of ratio words in each segment of the abstract. Mesh terms and keywords are the link to your articles in a sea of literature. So choose them wisely so that more audience could be reached to your articles. Thank you all. With this, we get into quickly to our next session, that is abstract writing activity. I request all the panelists to be there with me. So starting up with the abstract writing activity. For this abstract writing activity, we have given 3 assignments to all the participants and the panelists, and we requested them to summarize it into 300-word structured abstract as follows. Introduction, 1 or 2 liners, 20 to 50 words. Objectives or oblique hypothesis, 2 to 3 lines. Methodologies, 2 to 3 lines. Result, 3 to 4 lines. And conclusion, 1 to 2 lines. I request all the participants who has done these activities to open up their summarized abstract. So we are going to discuss it now. So our first assignment, we kept it anonymized, was on minimum. It was a JCOT paper. It was on minimum 12-year follow-up fixed versus mobile bearing total knee arthroplasty, double-blind randomized trial. Article title was not given to the participant. Participants were provided with the introduction, methodology, results, etc. So they have summarized it. I have populated some of the common introduction pointers which have submitted by the various participants. I would like our panelists to take up one by one statement and give you a comment. What is inappropriate in this introduction to you? So my first, I'll call Dr. Amit. My first statement is broadly 2 types of implants are used in knee arthroplasty, fixed bearing and mobile bearing. Although FB provides satisfactory result, RP may pair advantages as there's a reduced implant wear. However, there's a paucity of literature comparing the long-term benefit of the two. Dr. Amit, what do you find not relevant in this? Or what would you like to delete from this, or how about it? Dr. Amit? I think we lost Dr. Amit. Dr. Karthikeyan, would you like to say?
Yes. So I think the introduction lays out very well. But if you will see in this structured abstract, they have combined the aims of the study in the background itself. So therefore, though they are looking at two types of prostheses which we commonly use: rotating platform and fixed bearing. And there are lots of articles already written. However, they have not emphasized as to why this study. So that laying out, they could have said this is a longer period of follow. Probably that they could have added in there. That's all I can think of.
Right. Dr. Chawla, would you want to say something on it? Okay. I'll take on this.
Right.
Yes.
Yeah, please go ahead. Please go ahead.
So to me, the first statement I find, as Dr. Amit already stated, we should, avoid the unnecessary words. For example, in the first line, that broadly, there's no need of these kind of words. We may avoid these words. And the two statement which is written here is that they have clearly said about the TKR, knee arthroplasty and fixed bearing. They are discussing it out. But they are simply saying, however, there's a paucity of the literature comparing the long-term benefit of the two. But if you talk about in the fourth statement, which is another introduction submitted by another participant. So I liked it that we need to find out the gap analysis. So this is the right statement, I think, more right statement that meanwhile, rotating platform construct have biomechanically shown reduced polyethylene wear and lower the risk of component loosening and better replicate anatomic knee motion. So that is a better put forward statement in case of introduction and background. So, so we move to next objective put up by the different by the participants. So these are the four objectives put up by the different participants of the same assignment. So Dr. Karthik, would you like to comment on it? All the four objectives, which do you find more appropriate?
So I think the first objective is the aim of the study. So yes, the article is looking at fixed bearing and rotating platform. I think if I go to what I was trying to say in our previous sessions, is your title or objective should have components of what is the population you are studying, what is the intervention, what is the comparison, what are the outcomes, and what's the type of study design. So your sentence should contain all these 5 components. So you can, the third one I like, the aim of this prospective randomized trial is to compare the efficiency of fixed versus rotatory platform in primary total knee. There is no need to add the long-term follow-up. I think that should come before. I think I like the third one.
So,
and the fourth one, we should not comment on specific company designs in our aims, I would say. So we should not say PFC, Sigma, DPU unless it is necessary. So I would say it should have, number one, the population is the patient undergoing TKR. It is randomized, that's the study design. It's prospective, that also is study design. And then it's comparing fixed versus rotatory, and that should explain it. Third one is the one I like.
Thank you. Dr. Chhabra, would you want to say something on these objectives?
No, very well summarized. I would only want to say that if we combine the first and third, it may come out to be more ideal in that. In the first one, the two aims of functional outcomes and implant survival both have been mentioned, and that in the third one, although we may say that efficiency comprises both of them, but the first spells them out clearly.
Thank you. Dr. Jeshri, are you there?
Yes, Dr. Pooja, I'm here. Yeah.
Yeah. Would you want to add something on these statements, subjective statements?
Yeah. Not really, Dr. Pooja. I think the points have been well covered about the objective. It's very clever to bring in the study design also, so you're saving some words from the methods also. Yeah.
So I agree that. So in objective, for the participant, I should say that it should be very clearly what kind of study design it's there. So here people have used a term prospective randomized trial, which is very important for them to use it to clarify that what kind of study it is, right? And we need to avoid, as in the fourth statement, we need to avoid these kind of words like what kind of make it is, or maybe any company name. You need to judicially use your words. Do not waste these words on the company specification or other things. Thank you. Now I move to methodologies. Right. So methodology, Dr. Jeshri, these are the two statements in front of you. Would you like to point out what's the problem with these methodologies?
Yeah, I'll take a minute to read them.
Yeah, sure.
I both read well to me. I think if there is a stricter word count, I'll go with the second one compared to the first one. And first one, I think the term blinded has been slightly used in a sense to mean like only patients were blinded, but from what is written in the second one, it's a double-blinded study. So maybe I would prefer the second one, but a lot depends on how much is the word count. I believe this is a 300 word abstract that you've asked to report. If possible, people are curious about sample size calculation. You could see, you very clearly mentioned in the beginning, abstract is a lot to do with economy of words, but that doesn't mean you say less. You say more with fewer words, and we generally take up to 10 drafts to finalize an abstract so that you pack more and more and more into fewer sentences. So I would have liked to see something about, maybe the sample size. And I'm reading this as a complete outsider. I'm not a subject expert. So I'd like to have seen that. And
okay, I add one more point from my side. In the second statement, there is no need to write where all patient was randomized in NY. So when you are already writing it double-blinded prospective control trial, there is no need of these words. Do you agree with me, Dr. Jeshri?
Again, depends, because there is a possibility that you randomize them before. I mean, again, I'm not a subject expert, but generally that gives me an immediate insight as to at what point randomization happened, because I was actually typing that, because you will ultimately ask the statistician to randomize the person. So at what point? Is it at the point where you enroll them into the study, or is it an intraoperative decision that you randomize them into either arm or whatever? So I still think the point of randomization is relevant, but if you think, it can be saved for the full text and need not necessarily show up in the abstract, I think that's fine also. Maybe a word on how randomization was done, what type of randomization was done could have also helped. Yeah.
Right. Thank you, Dr. Ashri. Now we'll move to results side. So most of the participant has well articulated the results, but I would like to know the panelists that much of maybe variance statistical significance do we need to put up in the abstract?
Hi Pooja, somehow my internet is kind of weak, so I am not switching on my camera. So reading these results, I totally echo with you that in the abstract, this is about the abstract we are discussing, I believe, right?
Yes, it's a result part of the abstract. The 2 lines are the result part of the abstract.
I think there's too much analysis will make the reader confused. So you can, remove unnecessary, this kind of analysis, but have the key point, because, you certainly cannot describe everything in the limited words. So therefore, rather than making readers confused, you just make more clarity what you would like to put in this section. Thank you.
Right. Dr. Karthik, would you like to say?
I will have to go back to the previous section. So the methodology is flawed. I think they should have started by saying this prospective randomized control trial looked at fixed bearing and rotatory. However, each methodology section should have a primary outcome, secondary outcome, mention about complication, and then briefly about the statistical test they used. So I like the first one. So first start by saying this is a prospective randomized control trial. We looked at rotating platform and a fixed bearing knee. The primary outcome was XXXX. The secondary outcome was XXX. And the statistical test we used was for survivorship, Kaplan-Meier. For subjective health questionnaire was SF36, and what should I say? Functional knee scores were used. That's it. And therefore, building on from that, the result should be complementary to your method question. So they should divide probably into saying the mean age, that is fine. Then divide your results into 4 things that they have looked at. They have looked at the clinical outcome. They have looked at the functional outcome. They have not importantly looked at radiological outcome. And also they looked at the SF36 and they looked at subjective. So these 4 things should come in the result. And if you have time, yes, put your confidence interval. That makes it look impressive. So I would go by the second one. I like the second one. But I think there is no radiological outcomes, and you should probably distinguish for a lay person to know they have looked at clinical outcome, functional with WOMAC and knee scores. They have not looked at radiological. They have looked out at SF36 and the subjective score. And that should be it, really.
Okay, so to summarize on the result section, if we say that when we have to compile only 3 to 4 maximum line in the results, so we should mainly emphasize what we are put up only those results which are relevant to our main primary objective, right? And analyze and put the analysis to maybe saying that confidence interval or maybe p-value, but not too much of elaboration, so that it should not be difficult for the author or readers to read out and understand it. Am I correct, Dr. Karthik? Okay.
I totally agree. Put positive outcome there, main findings out there. Remember, we have a restriction of word limit in a structured abstract. So you have to fit everything there. So positive outcome, unless there are something drastic complications, positive outcome, and one sentence on effective statistical p-value or confidence interval that has made a significant difference in the article. That's all you need.
Thank you, Doctor. Thank you. So now moving to conclusions. So with this article, I chosen these four conclusions, which is written by the participants. Dr. Chhabra, would you like to comment on these?
I think the first one summarizes well. The use of a fixed bearing or rotating platform design does not convey significant superiority in terms of function or implant longevity at a minimum 12 years after. At a minimum 12 years follow-up after total knee arthroplasty, right? So maybe the follow-up word should have been there. And it should be more like a conclusive statement. We found no statistically significant difference, means this is putting irrelevant aspects into that. We do not need to mention which were the outcome measures which were used, etc. here. We just need to conclude what were with regard to the aims of the study that needs to come, right? So the aims looked into implant longevity and function, and that should come clearly and concisely within the conclusion. I think that's I think I would go with the first conclusion, just adding follow-up to that. I would only want to mention one point here, Pooja, when you had shown the manuscript, the title of the manuscript, right, which is also very important, though we are discussing the abstract. But the title should also convey what is being done in the study. So title and aim and conclusion should resonate. That is very important. As the title only mentions minimum 12-year follow-up of fixed versus mobile bearing total knee arthroplasty, double-blinded randomized trial. Maybe title could have been a bit more comprehensive in this regard to include what were the aims and the conclusions of the study. So that's my only other point.
Thank you, Dr. Chhabra. Dr. Karthik, would you like to say something?
No, I like the first conclusion. That answers the query or the question they started off with.
Dr. Jayashri, I think you want to say something.
I was just going to say what Dr. Karthikeyan just said. So we generally encourage people to read their conclusion aloud, and it should, in one sentence, answer the research question that they started off with. Over to you.
Okay. Thank you. Thank you, all the panelists. In the interest of time, we are not able to take up other two assignments. But many participants had participated in this research activity, abstract writing activity, and we got a fabulous response. I would like to invite Dr. Chhabra to announce the winner of this activity. Dr. Chhabra, please.
Thank you, Pooja. I would, yeah.
I'm sharing the slide.
So thanks, Pooja. So the result is there in front of you. First, I would want to mention that anyone who participates is a winner. The essence is about participation. So I would want to compliment and congratulate everyone who has participated in the exercise. Of course, a few of them may have been able to put their summary across, abstract across a bit better. So congratulations to Dr. Shrishti Verma from Ludhiana, Mayank Garg from AIMS, Hina and Rajan Tiwari from Delhi. So they're all winners and they'll get a certificate from JCOT in this regard. And I would also suggest that we give a certificate of participation to everyone who has participated in this exercise. So because participation, as I mentioned, is very important.
Definitely, sir. We will definitely send the e-certificates to them.
And I think we'd want to end this webinar here with a special vote of thanks to everyone who has participated in this webinar, to Dr. Jeffrey Wang, who gave the keynote address and woke up early in the morning on a Sunday to be with us and to disseminate information in this regard. We look forward to a long-term collaboration with them. Of course, to all the moderators and the faculty who have participated in the webinar today, it has been a wonderful session today, and very especially all participants who have been there with us for the webinar. A special word of appreciation and thanks. Of course, my special thanks to Pooja for having been like the master of ceremonies and having moderated it so well, but would also want to thank, of course, JCOT and the publishers. Priyanka was there with us for the webinar. The Delhi Orthopedic Association, who gives us the opportunity to have JCOT as the official publication of Delhi Orthopedic Association. But I would also want to thank a lot of people who have worked behind the scenes for the success of the webinar. I would want to make a special mention of Dr. Gayatri Vishwakarma and Vandana Phadke, but also Ravinder, who has been there working and ensuring that there are no IT issues per se and facilitating everything. A special word of thanks to OrthoTV for letting us use their platform for this webinar, not only this time, but they also had come forward last time to let us use their platform. So I may have missed out on some. Please pardon me if I haven't taken names independently, but would want to mention that this entire exercise was carried on by the training committee. So a very special thanks to the chair and to all members of the committee. And we look forward to having you again next Sunday, same timings, with another, so that we can discuss in continuation, and also we could listen to the keynote address by Dr. Michael Fairlings from Canada, one of the most prolific authors per se. So thank you, everyone. Thank you, Dr. Karthikeyan, and all members of your committee. And thank you, Pooja. Thanks all participants.
Thank you, sir. Thanks a lot to all the moderators, to all the panelists.
Thank you very much.
Thank you, Dr. Chabra, for giving us the opportunity for conducting this activity. My special thanks goes to all the participants who participated in the activity and was with us. If any question which we are not able to answer through this webinar, you have our email IDs. You may put the question to us. We will definitely get back to you. Thank you all. Thanks a lot.
Thank you. Have a great evening, great day.
Thank you. Thank you, everyone, sir. Everybody, good
Depending
night.
on which
Good night.
part
Take
of the
care.
world you are. Bye.
Okay. Good night, sir.
Good night.
Good night, sir.
Good night.